Assalamualaikum untuk adik-adik mahasiswa. Tolong rename namanya sesuai dengan grup ya yang sudah dibagikan di WA kemarin. Jadi nomor grup 1 sampai 20 kemudian nama. Ya, ini sekarang pagi ini adalah sesi pertama. Silakan yang ada di grup di sini adalah mahasiswa sesi pertama. Jadi bukan kelas alfa beta gamma tapi langsung grup. Silakan di rename.
Bud, belum mulai, Bud.
Belum Pak, nanti Prof Nori langsung yang ambil alih.
Oh, Pak
Kita
Bud. Ya, Bud.
menyiapkan saja. Ya, kita mendengarkan, nanti tutor hanya mendengarkan dan mengarahkan waktu saja.
Baik,
Mahasiswa
baik.
aktif diskusi. Ya,
Jadi, Budi kapan dipanggil ke KPA tadi? Jam berapa?
ini sekarang lagi di ini Pak, di Unsri Bukit.
Oh, jadi masalah serdos ya, Bud ya?
Iya, kata Bu Mila masalah serdos. Bukan masalah sih, cuman nanya-nanya aja katanya.
Oh iya, Payu. Oke, Bud. Kasih
Iya,
Bud ya.
iya Pak, ya Pak, ya Pak.
Tolong itu yang pakai tanda titik coba dirindam siapa ya? Ada 2 tanda titik.
Budi. Terangkap ya dulu Budi, sebentar Budi, ayat Budi. Tahap-tahap apa sudah baca semua mereka?
Sudah dong, sudah dikasih pengantar ini kemarin di grup WA.
Ya udah, sambil
Tapi
nunggu
belum
atau biar saya aja yang nerangkan sebentar ya adik-adik semua ya. Baik ya. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi semua ya. Jadi kita hari ini pada sesi keempat ya, sesi keempat dari Insightfull Moment dengan world class profesor. Nah, kita pada hari ini beruntung sekali kita kedatangan tamu dari Gunma University, yaitu Profesor Noriyuki Koibuchi. Beliau adalah guru besar dan kepala Departemen Fisiologi dan Integrated Physiology dari Gunma University Jepang. Di mana hari ini dia ingin membawakan metode pembelajaran yang agak berbeda. Kalau yang lain memberikan kuliah tamu, kuliah saja, hari ini beliau ingin menyampaikan pembelajaran melalui metode team-based learning. Mungkin adik-adik kemarin sudah pernah belajar team-based learning, tapi kali ini team-based learning-nya agak sedikit berbeda ya. Team-based learning standar yang memang berlaku di seluruh dunia, yang memang awalnya itu diberikan oleh Michelson gitu ya. Team-based learning di mana lebih simple, lebih sederhana ya. Nah, mungkin adik-adik sudah baca ya. Jadi nanti urutannya begitu kita mulai, nanti Prof Nori kalian akan dikumpulkan dulu di grup besar ya, di grup besar. Kemudian Prof Nori akan memberikan introduction, pendahuluan. Kemudian dia akan memperkenalkan diri beliau. Lantas nanti lihat di chat ya, setelah perkenalan beliau akan memberikan tes ya, soal MCQ. Nah, nanti dia akan kirim via chat. Jadi kalian harus pakai laptop ya, jangan pakai HP ya. Jadi dia chat, nanti di-download soalnya tersebut. Kemudian setelah soal di-download, kalian langsung jump to grup masing-masing ya. Kemarin sudah dibagi Dr. Budi grupnya ya, grup pagi 1 sampai 20 dan grup siang 1 sampai 20 ya. Nanti langsung jam, jadi tidak menunggu admin untuk menjoinkan kalian ke grup ya. Jadi kalian sendiri yang proaktif untuk loncat ke grup masing-masing biar cepat ya. Nah, pada grup itu, pada diskusi grup pertama itu nanti kalian akan bersama-sama menjawab soal dari Prof Nori tadi ya. Soal Prof Nori, berapa menit Budi hari sesi pertama itu saya lupa. Mungkin sekitar 20-30 menit.
15 soal
15 menit.
itu 10 menit ya.
10 menit ya.
Ya, untuk individual jawabnya.
Ya, oke. Kemudian habis itu bukan individu langsung dulu. IRED.
Oh, kalau yang di sini IRED individual ini Dok. Individual test, kemudian tim red ini.
Ya, tim red ya. Jadi nanti jam 15 menit langsung individu, terus nanti diskusi ya di grup masing-masing ya. Berapa menit Dr. Budi?
Yang diskusi di grup masing-masing 20 menit.
20 menit. Nah, ya. Kemudian nanti saya lupa ya. Ada 8 grup untuk yang pagi itu akan ada 8 mahasiswa Jepang ya. Jadi ada masing-masing grup 1 sampai grup 8 itu akan ada 8 mahasiswa Jepang. Jadi untuk grup 1 8 mungkin 1 menit 2 menit pertama itu kalian tunjuk moderator atau juru bicara. Kemudian nanti perkenalkan diri Anda masing-masing sebentar ya untuk grup 1 sama grup 8. Sekedar menyebutkan ini aja, sekedar menyebutkan nama saja ya. Hello, my name is ini, you can call me siapa gitu ya, itu aja ya. Nanti habis itu langsunglah berdiskusi. Nah, setelah itu nanti kalian akan jam lagi ke session. Habis menjawab soal tadi, kalian akan ke jam session, ke main session ya, ke ruang diskusi utama. Kemudian nanti akan berdiskusi dengan Prof Nori ya mengenai jawaban kalian. Nanti Prof Nori nanti akan menanyakan ke wakilnya masing-masing mengapa memilih jawaban itu, apa alasannya dan sebagainya. Kemudian pada main session itu juga setelah kita bersama-sama berdiskusi dengan Prof Nori, kemudian Prof Nori akan memberikan skenario kasus ya. Untuk pagi dan siang berbeda skenarionya. Nah, kemudian kalian nanti membaca sebentar, di-download juga ya, di-download juga. Nanti Prof Nori akan mengirimkan skenarionya melalui chatting ya, melalui chat. Di-download juga, kemudian baru nanti masuk lagi ke diskusi kelompok ya, diskusi kelompok. untuk membahas skenario tersebut dan berusaha menjawab soal yang ada di skenario itu. Jadi nanti skenario itu di bagian bawahnya ada soalnya. Nah, kalian akan menjawab itu. Setelah itu kalian berdiskusi berusaha menjawab, ya. Kemudian setelah selesai, diskusinya berapa menit ya, Dokter Budi? Sesi kedua itu saya lupa. Dokter Budi, halo? Oh, Dokter Budi lagi ini ya. Jadi cukup lama, kalau tidak salah 50-60 menit ya, saya lupa ya. Nah, nanti habis itu akan jump ke main session lagi, ke main group lagi, jadi grup pleno lagi. Ya, kemudian di situ juga diskusi bersama dengan Prof Nori untuk membahas jawaban kalian. Dan sekaligus juga nanti Prof Nori akan memberikan mini lecture, ya, jadi kuliah-kuliah singkat ya terkait dengan pertanyaan atau jawaban dari pertanyaan tersebut, ya. Nah, mungkin itu. Nah, kemudian juga habis acaranya habis itu akan selesai, ya. Habis itu akan selesai. Nah, habis itu nanti kalian untuk kalian kalau dari untuk kalian diharapkan nanti mengumpulkan laporan kalian, ya. Laporannya berupa jawaban-jawaban dari pertanyaan Prof Nori itu, ya. Kemudian nanti pada sesi yang berbeda nanti tim FK Unsri itu akan mengirimkan soal, ya. Kalian akan menjawab, dikirimkan soal melalui Google Form. Itu nanti untuk evaluasi formatif kalian ya pada sesi ini, ya. Ingat kan seperti biasa ya, kita akan selalu ada evaluasi formatif dan khusus untuk kegiatan Prof Nori akan diberikan evaluasi formatif juga, ya. Itu nanti di sesi yang berbeda, ya. Jadi itu saja mungkin dari saya, ya. Silakan kita sambil menunggu, ya, dari Prof Nori. Nah, untuk tim siang mungkin Dokter Budi apa boleh sudah dipersilakan untuk keluar atau bagaimana? Halo, Dokter Budi? Sudah, tidak apa-apa. Jadi kita tolong untuk tim siang disilakan untuk mahasiswa yang sesi siang silakan untuk keluar ya dari roomnya, ya, istirahat dulu. Nanti kita ketemu lagi pada siang hari ya, jam 2 ya. Oke. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Oh ya, mohon maaf ya, saya lupa ya. Nanti juga ada dosen-dosen pembimbing kalian yang ikut juga dalam mengamati ya, mengamati jalannya diskusi ya. Jadi nanti dosen-dosen kalian juga ikut nimbrung ya. Tapi mungkin mereka itu sama seperti tutor ya, dia akan sebisa mungkin tidak ikut intervensi ya. Oke, itu saja. Terima kasih.
Toh, itu siang yang grup berapa sama grup berapa? Pagi grup berapa sama grup berapa, Toh?
Sama Pak, 1 sampai 20 juga Pak siang.
20.
Jadi siang 1 sampai 20. Jadi itu kelas mana itu ya, Toh?
Kalau saya yang pagi ini beta sama alpha ya deh ya.
Oh gitu, beta sama alpha pagi ini, nanti siang
Separuh-separuh Pak. Beta full sama alpha separuh kalau kalian pagi ini. Nanti siang sama alpha.
Oh, jadi pagi ini alpha full, beta setengah gitu?
Iya, setengah. Betanya full, betanya.
Betanya yang full, alpanya yang setengah.
Halo, grup berapa yang mahasiswanya? Naoko Shimanuki. 27. Grup 7 ya. Oke, no problem. Ada tuh, ada kedua. Ya, ya. Naoko tidak bisa hadir karena sakit ya. Kamu kalau aku join kursi dong. Aku join tuh. Kursi siapa di sana? Nah, kita dua orang yang semua tadi bisa mengamati ya linia mereka. Kalau sebelum jam 9 mereka belum mau masuk ini. Kemarin juga kami pada saat rapat Nori itu jam 9 baru dia join. Belajar ya dari kultur mereka. Ya. Kan kalau seperti ini biasa sudah masuk duluan ya, ngobrol seperti itu ya. Saya belum masuk. Mudah-mudahan tepat waktu ya. Karena tadi email terakhir dari beliau ya, jangan terlalu tegang, santai aja ya masih 10 menit lagi. Kalau yang mau ingin kuisi silakan aja ya, anggap seperti biasa ya. Lalu adik-adik semua, Prof. Nori sudah hadir di tengah kita ya. Halo Prof. Nori.
Okay, hi.
Hello, good morning.
Good morning. How are you?
Fine, thank you, thank you.
Yeah, it's a great day.
Yes, but here in Palembang is already 1 week. The rain never stop.
Oh, really? Oh, that's bad. So it's a rainy season now?
Actually, it is already changed the session. We are going to summer, but I don't know what happened because actually the rain is not usually comes anymore in March.
this comes every day for this week.
Okay.
Oh yes, I
Yeah.
forgot to turn on
Yeah.
my camera. Okay,
Yeah.
now you can see me.
Where are you? No, there is more than 140 students, so I cannot find you.
It's not 140, but the student is only 120. But
I
remember
know.
that 20 is a teacher.
Yeah.
Faculty members. Okay, probably.
Yeah.
So your background is Ubud,
Yeah.
Bali.
This is Ubud. It's my favorite place for the vacation. So this is Ubud. Oh, you realize it? I'm happy.
Yes, yeah.
Okay, I'm looking for whether Guma student has already.
Yes. Okay.
Okay. They're
Right.
logging in. Yeah, they started logging in. Okay, good. Okay, we still have 10 minutes to go. So
Yes, of course. Yeah.
anyway, I'm very happy to see the face of the Indonesian student. Yeah.
Yes.
Hi everyone. I'm Professor Koibuchi from Guma.
Say hello.
Hello, Professor.
Hello, Professor.
Hello, Professor.
Professor, good morning.
Yeah. Actually, I was supposed to visit your place, but unfortunately, because of COVID, I cannot visit you. And also, we are supposed to exchange some student. Professor Irfan was planning to send some of the students to Guma, but this is also canceled because of this COVID. But probably, hopefully, by your graduation, you may have opportunity to see me, or you may have opportunity to come to Guma for clinical clerkship. So anyway, I'm really looking forward to this.
I believe they will be clerkship in next 3 years. Yeah. The student will be clerkship in next 3 years. So I hope that they can meet you for the next years.
Yeah, I hope so. So it is very nice beginning to see all of you here.
Yeah, of course.
Yeah. Anyway.
Yeah.
So I'm just checking whether.
So anyway, that I heard that. Coba cari Gunma studentnya.
Yeah, Guma student. We have. I found 2 Guma students here. Yeah, but they should log in by the time. We still have 5 minutes. Yeah, so it should be okay.
Okay. So I heard that the Olympic Games will be going on, Prof. Nori?
Yeah, I think so.
Olympic Games in Tokyo will be still going on?
Yeah, a few days ago, there was agreement among the Olympic Committee, between the International Committee and the local committee. They will have the Olympic game in Japan, although no sightseer from abroad is not allowed to enter in Japan. So only athlete can enter. Yeah. So you cannot come to see the Olympic gaming in Japan. Yeah. So only athlete can come. No choice, as I told you.
Okay.
Yeah.
Not too crowded. Not too crowded.
Yeah. Vaccination schedule is still
Everyone
very behind. Yeah. Anyway.
So everyone will see from the television.
I believe so.
Actually, when I visited your place, I bought Olympic Tokyo 2020.
Oh, really?
So I keep it.
Good.
Because it's a very rare gimmick.
Oops. Stopped. Frozen. Prof. Irfan, your face is frozen.
Bad connection maybe, Prof.
seems that all Guma students seems to log in. Prof. Irfan, can you hear me? I cannot hear you. Oh. Wow. Okay, everyone, please wait. It seems that there is a big thunder in Palembang, and the internet connection has been closed to someone for someone. So please wait until connection is recovered.
Prof. Nori. Hello, Prof. Nori.
Hi.
I'm so sorry that just when I talk to you in the moment, we got thunder strike. So our connection is lost. So this is my emergency from my handphone.
Okay.
Yeah, my connection is lost, but our host still going on here.
Yeah.
So I believe it is already 9 o'clock. Is it true? 9 o'clock?
Yeah, it is. Oh, yeah. Yep.
Okay. Yeah. Maybe you can start your moment, your session.
Okay.
But first, I want to introduce you to our student and our teacher.
Okay.
Good morning, everyone. Selamat pagi. Assalamualaikum warahmatullahi wabarakatuh. Pagi Professor Noriyuki Koibuchi that this is our guest professor today. This is a part of Insightfull moment with the world-class professor. So this is the session number 4, Prof. Nori. We have already a guest lecture from Professor Cheng, Professor Adiat Mika, Professor Nengtina. So the number 4 is you today. And next we will get the guest lecture from Professor Rob and also Professor D. Silverton. So today we are very grateful that we have Professor Noriyuki Koibuchi that will be deliver us a different methods with others professor. Prof. Nori will be deliver the knowledge and experience with team-based learning methods. So it is very, very good opportunity for us to learn about the TBL because TBL is still new with us in here, our place. So maybe we can get experience about the TBL and then we also get knowledge and science from Prof. Nori. Okay, Prof. Nori, please take your time to lead this session. Okay, thank
Okay.
you.
Okay, thank you very much, Prof. Irfan. Okay, selamat pagi, everyone. I'm Professor Koibuchi from Japan. And actually, I brought some of my GUMA students to here, and they're going to also join the TBL. They have some experience in TBL, so if you got lost, you may be able to ask them about how you deal with the questions. Okay, so I will start my slide. Okay. Oops. Sorry, this is not the one. Okay, which one? Slide here. Okay, where is my slide? It's gone. Here you go. Okay. Before I start the scientific session, I'd like to introduce a little bit about Gunma. Gunma is located in the middle of Japan. Somebody said this is the very bottom of Japan. It takes about 1 hour from Tokyo to Gunma by bullet train. And we have a lot of national park, and you can go skiing, and you can see nice foliage. You can see a very nice lakes. And this is a hot spring. And this is also, our place is very famous for hot spring as well, although you have to be naked to bathe in the hot spring. Anyway, we have a lot of festivals, fireworks, and we have a close connection with Brazilian society. So we have a samba festival, and this is an old samurai costume festival, and several night dance, summer dance festival, or something like that. And Gunma University is located in the middle of our capital, Maebashi, and this is Gunma University here in the middle of the city. And our university was founded in 1943 as a Miles Medical School for 4 years course. Then right now, Gunma University has been transformed to the graduate school medicine. So our university is considered to be the research-oriented university. And this is several photographs that I brought. This is our university hospital, which have about 700 beds. And this is the main gate of the university. And we have a lot of tools at PET, SPECT, MRI, and other imaging tools. And particularly, we have a heavy metal ion therapy center. So by using heavy metal ion, you can do the therapy for the cancer patient. Only 3 universities among the world have this kind of center. And of course, we have a lot of training facilities such as skill lab. And also we have more than 40 research laboratory. We have about 500 publications per year, which include Nature, Science, Lancet, JBC, Cancer Research, Blood, Endocrinology, etc. Oh, by the way, if you think I'm speak too fast, just let me know. I'll try to speak slowly. So
No, sir.
Yes.
You speak in average version.
Okay. I'll speak a little bit slower. Okay, this is my self-introduction. My name is Noriyuki Koibuchi. I'm born in Maebashi, capital of Gunma, and grew up Hitachi, Ibaraki. Probably you have known the name of Hitachi because this is the name of the company also. And my position is professor and director of the Department of Integrative Physiology, Gunma University Graduate School of Medicine. And my research specialties, endocrine physiology, environmental physiology, and my clinical specialty, endocrinology and metabolism, and a registered diabetologist. And this is the position where I used to work in the Harvard Medical School, University Hospital, and I took some of the medical students to the Harvard for the clinical clerkship. Okay, so we're gonna move on to the TBL. Probably this is your first experience about TBL. Team-based learning is a small group learning that emphasizes student preparation, the class, and application of the knowledge in class. So I believe that you already have heard a lecture from your teachers about endocrine physiology. So you have to utilize this knowledge to apply your knowledge to solve the questions that I'm going to give. So students organize into diverse teams of 5 to 7 students that work together throughout the class. Students should prepare by self-study prior to class. I believe all of you did self-study. Okay, so today's schedule, we have already started. So brief introduction, 5 minutes. After that, actually, I will give the exam. I'll give 50 questions. Okay, I'll upload right now. Okay. Okay. Here you go. Okay. I sent questions. So you need not, you can download from now on. So I will give 10 minutes. And you have to solve 50 questions during 10 minutes. Then after that, we will start the group discussion. And this is gonna be about 20 minutes. So you have to discuss which question, which number is correct in each question. Then you have to select one representative who will submit the answer upon request. Our request, okay, let's say like, okay, question 1, what is the answer in group or something like that. Okay, after that, so there's study session. And then after that, case presentation. So case will be presented through chat and group discussion. And the group discussion will be on case. Oops. What's wrong? What's wrong? My screen is gone. Okay. Can everyone see my slide?
Yes, Professor.
Yes.
Okay, thank. Okay, so after case presentation, we're gonna do the second group discussion. And this is a discussion about the case. Then after that, we will have a study session and our random select student to reply. And after that, we have a brief summary and conclusion section. And then the total time for the class will be about 3 hours. Okay. All right. Okay. So, something is wrong. No, wait for a moment. Whoops, something is wrong. So did everybody downloaded the exam? If so, okay. If so, you can start solving the question by yourself. After that, we will have a group discussion session for 20 minutes. So right now it's 9:15 in your time. So I will give 10 minutes. So you can answer by 9:25. So please start. So solving your questions. Okay, I hope this is not so difficult for you. And most of them, most of all items have learned, I believe, in the class. So please start answering your questions.
Prof. Nori, do they have to join to the group?
Not yet, not yet.
Not yet, okay, not yet.
At first, they have to answer the question by themselves. So
Okay.
we have to wait
Jadi
for 10 minutes. Yes.
Oke. Jadi adik-adik semuanya silakan jawab dulu pertanyaan tadi yang di-download ya, di chat. Nanti pada saatnya begitu ada perintah masuk ke grup, baru masuk ke grup ya. Jadi jawab dulu pertanyaannya. Selama 10 menit ya, Prof. Nori memberi waktu 10 menit, silakan.
So when at 9:25, you can divide student into groups.
Okay. Okay. So everyone can join the group in 9:25 ya. Jadi jam 9:25 nanti bisa silakan masuk because the group is already open and you already know the number of your groups ya.
But please wait,
Yeah, please wait. Okay,
yeah,
please wait.
until you finish the answering the questions.
Jangan dikirim dulu ya pertanyaannya ya. Prof. Nori kirim chat, do not send the answer until I request. Jadi jangan dikirim dulu pertanyaan, simpan aja dulu pertanyaannya ya, jawabannya ya. Jawabannya disimpan, keep your answer by yourself. Ya. Do not send until Prof. Nori request to send it.
Somebody already sent the answer, but please do not send the answer until I request. You have to discuss your friends first, okay, to select the one answer, okay? Important thing is not to send me the correct answer, but to discuss among students to make some conclusion which one is correct, okay? So making mistake is not bad for you, okay? Don't worry about making mistake, but the important thing is to discuss among students to find out correct answer, or how you thought the answer is correct or not. Okay, so do not send the answer until I request. Okay, you still have 5 minutes. I keep on sending, no, not to send, do not send the answer, but already 2 of them have sent me the answer, but please do not do that, okay? Until I request to send me. Okay, so group discussion will start soon. So if you want, if you finish answering the question, you can start entering into the group. And please introduce yourself at first because some group has a student from Japan. So please introduce yourself and please disclose your face to other members during group discussion. This is very important also. Do not use icon, just show up your face and discuss for 20 minutes. Okay? So if you have already finished answering questions, you can enter the group. Well, there is another 1 minute anyway, and we will start group discussion.
Adik-adik, menu breakout room-nya sudah tampil belum?
Sudah, Prof.
Oke ya, nanti pada saat momen, so the breakout room menu is already show up. So when the Prof Nori said to jump to the group, so please jump to each of your group that already shared to you yesterday.
Yeah, please start discussion. Okay, please jump into your group.
Okay, please jump to your group.
Okay, and start discussion. You have to select one correct answer. Okay.
Okay, Prof Nori, they are joining to each group now.
Good.
Untuk para dosen yang sudah dibagi grupnya for the faculty members who already deliver the each of group, please also join to your group, but please keep silent. Silent is better for you. Just observe their discussion. Thank you.
Yang mahasiswa Jepang ini
Already? Ya.
ya masuk ya. Saya
Oke. Dia baca tak nengok ni?
bisa.
Iya. Iya, di mana di sini? So, Prof Nori, you can see the group.
Yeah. I'm gonna visit each group from now on.
Yes.
Yeah.
Please, Prof Nori, please note that the name with no number is the faculty member. Sorry.
Dokternya kan kalau nggak tampil ke seluruh ini, berarti masuk join.
Hah?
Yang kalau mau konsep,
Ini. Join ya, Prof Nori ya kan? Join kan? Sekarang tadi screen ya. Arkan belum join. Nadia, please join to your group. Mirah Martiani, group 11. Group Paras. Silakan join masing-masing ya. Pak Sada, kalau mau join, Siska silakan mau join, Dr. Heri ke grup yang masing-masing. Kita join dulu ya. Terhalang. Ya. Nanti masukin ke grup 10. Ini grup 3. Grup 3. Ya, itu di terus 3. Itu Muhammad Hatib grup 3. Sudah. Siska grup 2. Satu pernama sehari. Bukan namanya. Nada, hari-hari. Bikin ada grup 8 atau grup 8. Sudah aku cek grup 1. Hari grup 1 dia masuk. Hari grup 1. Nori pindah ke grup 2 nih. Grup 1.
Prof. Irfan, are you here?
Hello, Prof. Nori.
So when we will finish the breakout session? 50? 9:50?
9:50, I think so. But some group I see that the discussion very slow.
Yeah,
So
I noticed. So some group is very quiet.
okay,
So
but
we
it's
may
okay.
have to wait another.
We have to remembering them.
Well,
Another maybe 10 minutes more.
yeah, we may have enough time to. We may not have enough time for the lunch, but if discussion is very slow, maybe we have to wait like at 10 o'clock, right?
10 o'clock. Okay. Okay.
Right. So just tell them. Yeah.
I noticed that one or two groups still discussing in number 4 question.
Oh no.
So I have to remembering the faculty
Yeah.
to be equipped. Okay.
Yes. Okay. Until 10.
Okay, until 10. Okay, yeah.
Okay. Good.
Yang mana tadi, yang kelompok mana tadi ya? Kelompok 8. For group number 10, please wait for your friends.
Mhm.
Dr. Alfian, I think the time to discussion are
Oh, masih ini ya.
ya dok. Apakah kami boleh kembali ke breakout room?
Ya, boleh masuk lagi aja. Sorry.
Oke, terima kasih dok.
Prof. Irfan, Professor Irfan, you hear me? Prof. Irfan, you hear me? Prof. Irfan or some staff of physiology department staff can hear me? We have to finish the breakout session at 10 o'clock. So please finish the breakout session right now.
Please, Dr. Eka or anybody, please tell the faculty members in the room to go to main room.
Yes, please.
Suruh mereka. Okay. It is okay if they do not done yet, I think.
So,
hello, Professor Nori. How are you?
Hi. So, can we start the study session? Okay. Okay, everyone.
We just got 3 group members. Okay.
Yes. So everybody, all student is here now? Not yet? Please come. I still see.
Only 3 group. Already 4 group. Okay.
Yeah.
I will jump to each room to tell them. Room 1.
Kok hilang? Balik ke YouTube lagi?
Zoom, klik zoomnya, Bro.
Mana?
Bawah, yang biru itu.
Zoom ya?
Klik. Nah, itu.
Okay.
So, Prof. Nori, I have to push everybody to the main room now.
Yeah. Okay, looks like everybody is here now. Okay.
Yeah. So, sorry, we have to push all of you to go to the main room. It is okay. It is not finished yet or not. Okay. We have to continue our time.
Nomornya
Tadi di mute kan?
Okay. So welcome back, everyone. So we're gonna start the report of the team result. So do not send it right now. Okay. So you as I told you, you are to select one representative student who can send the answer to me. Okay, like group 1, question 1, answer A or something like that. So if the all answer is correct, we can move on to the question 2. If someone send me a different answer, I will ask the group why you selected this answer. Okay? All right. We're gonna move on to the question 1. Which hormone receptor is mainly located in the cell nucleus? Okay, everyone, send the answer to me. Representative of each group, send the answer to me through chat.
Oke, masing-masing kirim jawaban perwakilannya, yang jadi moderator kirim atau sekretaris kirim jawaban ke Prof Nori sekarang pakai chat.
Okay, I received only 3. I received only 3 groups.
Oke, semuanya kirim jawaban nomor 1 pakai chat sekarang, langsung aja. 1 question grup berapa, dari grup berapa, question number berapa, jawabannya langsung hurufnya aja, A atau B atau C. Jadi grup 2 Q1 A atau B begitu. Grup 2 Q1 A atau B seperti itu. Ya, silakan kirim aja sekarang.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay. All group answered D. Okay, everyone, all group is correct. Of course, testosterone and other steroid hormone binds to nuclear receptor. And also thyroid hormone also bind to the nuclear receptor. Other hormones such as insulin, glucagon, adrenaline, growth hormone can bind to the membrane receptor. Okay, so all group is correct. Okay. Next. Okay, question 2. Which hormone is hydrophilic? Okay, go ahead.
Hydrophilic reduction.
C. Oop. 8. C. 8. D. C. 8. C. Okay, all group answered. Okay, there is many group answered C, but some group answered A. Okay, group 3 answered A. So Huma, why you thought A is correct? Could you tell me why, or what kind of discussion you made in the group?
Yes, Professor.
Yes.
Maybe my friends in my group will answer that. Maybe for Nur Fadilatunisa will answer that, Professor.
Okay.
Okay, thank you, Mike and Professor. I think that cortisol, because the cortisol part of catecholamine, I think, but I don't know sure that maybe this for the answer. Thank you.
Okay.
Correct me, Professor.
Okay. Cortisol is also secreted from adrenal gland. So catecholamine, such as adrenaline, is also secreted from adrenal gland. But cortisol is secreted from adrenal cortex. Catecholamine is secreted from adrenal medulla. So cortisol is a group of steroid hormone, so which is hydrophobic, not hydrophilic. Okay, so A is, but not correct. But I like your discussion. Okay, so both of them is adrenal hormone anyway. Okay, other group said, group 17 said question 2 is correct answer is D. So group 17, Nuha. Okay, could you tell me why you made this decision? Nuha, you hear me? I cannot hear you.
Yes, Professor.
Yes.
I'm sorry. Before, from my discussion with my group,
Yep.
thyroxine is made from derived by steroid, and oxytocin is from peptide, and we make a mistake.
Okay.
I'm sorry.
Yeah, but okay, not only steroid hormone, but thyroid hormone is also hydrophilic. Hydrophobic. Okay, so the cortisol, estradiol, and aldosterone, all of these are steroid hormone, which is hydrophobic, and the thyroxine is also hydrophilic. So oxytocin is only the hormone which shows hydrophilic nature among these 5 groups. Okay, let's move on to the question 3. Which hypothalamic hormone suppresses the secretion of anti-pituitary hormone? Okay, send me the answer. Question 3. Okay, go ahead. D. Okay, all groups send the answer? Not yet? And please send the answer to everybody. Again, you don't feel ashamed even if you make a mistake. Important thing is to share your knowledge with your friends. Okay. All right. So some group say that many group show that the D is correct answer, but some said B is correct answer. Okay, so group 18, question 3, answer is B. Okay, Lutifi, can you tell me what kind of discussion you made? Group 18, Lutifi.
Yes, Professor.
Yes, go ahead.
Please wait, Professor. I discussed with my friend first.
And why you think TRH is correct? I can hear you. Or someone in the same group can help him. He is having a trouble. Someone in group 18 can help you. Can help him.
Ya, grup 18 langsung bantu ya. Grup yang lain juga nanti kalau ditanya, temennya juga harus bantu ya. Langsung aja. Siapa yang berpendapat tadi? B.
You are the team. I want to know what kind of discussion you made. Anyone?
Maybe
Yes.
thyroid releasing hormone is releasing from hypothalamus.
Mm-hmm.
So
Yes.
that's why we discussed that TRH is the answer.
Okay. Yes. TRH can stimulate TSA secretion. So it is not suppressor of the anterior pituitary hormone. Okay. So CRH, TRH, GnRH are hypothalamic hormone that can stimulate anterior pituitary hormone secretion. And the vasopressin is, of course, this is also secreted from media eminence, but most vasopressin is secreted from posterior pituitary and stimulate water reabsorption. So dopamine suppressed prolactin secretion in the anterior pituitary. So D is correct answer. Okay. All right. Question 4. Go ahead. C. Everybody answered? Everyone answered? Okay. Looks like. Any more? Okay. So all group correct. All group correct. So the role of growth hormone is to stimulate IGF-1 secretion from the liver. And also you have to know that IGF-1 is not only produced in liver, but many peripheral organs can also produce IGF-1, which is also stimulated by growth hormone. Okay, others are not stimulated by a growth hormone. Okay, thank you. Okay, question 5. Prolactin stimulates with what? Okay, go ahead. Question 5. Okay. Wow, you guys are doing very great, doing very good. Okay, all group answered. Okay, great. Everybody, all group made a correct answer. So milk production is stimulated by prolactin. Milk ejection is stimulated by oxytocin. The urine reabsorption is stimulated by vasopressin. Uterine contraction is stimulated by oxytocin also. Mammary gland development is stimulated by both estrogen and progesterone. So milk production is stimulated by prolactin. So all group made a correct answer. Okay, number 6. Which clinical symptom is not seen in a acromegaly patient? Go ahead. Wow. Okay. Other groups? Okay. Most group answered C, but some group answered A. Okay. Group number 8. Anissa, could you tell me what kind of distinction you made in the group? Group 8.
Yes, Professor. I
Yes.
guess Najla would like to explain why we choose A as the answer.
Mhm.
Please, Najla.
Okay, I think the answer is A or thirst because I think it's not seen, but the patient can feel the unstoppable thirst, and osteoporosis can caused by acromegaly. So I think it's one of the symptoms of acromegaly.
Okay. 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 Thirst may not be caused directly by the excess of growth hormone. However, acromegaly patient can become diabetic, okay, because their blood sugar is elevated. So the symptom of acromegaly patient is very similar. Sometimes that's very similar to diabetic patient because of their blood glucose level become very high. So because of that reason, acromegaly patient usually have thirst. Okay. On the other hand, osteoporosis is not commonly seen in acromegaly patient because the role of growth hormone is to accelerate the bone formation, okay, through stimulation of osteoblast. So osteoporosis, of course, when the patient gets older, it may be seen, but it's quite rare, okay? So the C is correct answer. Okay.
So which mean that this unseen, Prof. Nori,
Yep.
thirsty is can be felt by the patient,
Yeah.
but number C is unseen, so do
Yeah.
not realize that.
Not
Okay.
seen. Okay. 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 So question 7. In the kidney, vasopharisty mainly act at which part of the kidney? Go ahead. 7. Question 7. Question 7. Go ahead. Wow. Wow. Wonderful. Okay, thank you. Okay, all groups made a correct answer. Of course, vasopressin mainly act at collecting duct. And on the other hand, aldosterone. Aldosterone may also act at distal tubule and collecting duct. So depending the hormone, the site of action is different. Okay, great. Okay, question 8. Which phenomenon is not seen in islet beta cell after glucose uptake? Go ahead. Wow. You guys are doing great. Wow. Okay. 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 So, all group made a correct answer. Yes. When glucose is uptaken in islet beta cell, of course, ATP synthesis is increased, causing the production of ATP through TCA cycle. TCA cycle activation called the synthesis of ATP. Then ATP sensitive K channel is closed by increased glucose. Then resting membrane potential is increased, depolarized, then intracellular calcium level is increased, causing the secretion of insulin. Okay, everybody made a correct answer. Congratulations. Okay, question 9. Go ahead. The action of insulin is to stimulate D. Well, okay. Any? Good. Okay. Wonderful. Okay, all group made a correct answer. Yes, the action of insulin is to stimulate glucose uptake. Okay, but so the insulin is to inhibit appetite by acting at the hypothalamus. Please keep in mind. And insulin is inhibit lipolysis. Okay, and insulin accelerate glycogen genesis, not lysis. And insulin accelerate protein synthesis. So the D is correct. Okay, question number 10. The action of insulin is greatest in where? Okay. Okay, so B or E or C. So many different answers. Okay, I have to tell you, one important thing. Okay, it is a little bit difficult question to answer, but you have to think about the anatomy of pancreas. Okay, insulin is secreted into portal vessel, right? So portal vessel can go through liver. So many insulin is utilized in liver. So compared to other organs, concentration of insulin is greater in liver. So you may consider that cardiac skeletal muscle is also the target of insulin, and adipose tissue is also the target of insulin. But compared to liver, the concentration of insulin that act to these organs are less. So the insulin action is greatest in liver. Please keep in mind, this is a little bit difficult question because you also have to know the anatomy of the pancreas. Okay, question 11. Which glucose transporter is activated by insulin? Go ahead, question 11. C. Okay. Okay. One group said B. Okay, group 13 said B. Question. No, sorry, this is question 11. Sorry. I'm sorry. Question 10. Question. Okay, everybody said C is correct. Yes, thank you very much. So all group is correct. GLUT4 is activated by insulin, particularly in adipose tissue and skeletal muscle. GLUT2 is also very important glucose transporter for the insulin action because GLUT2 is expressed in both in liver and the beta cell, which help to uptake the glucose. Okay, question 12. Oops. How many ATPs are produced from one glucose molecule by anaerobic glycolysis? Go ahead. Question. Okay. Okay, good. Okay. Other answer? No? Okay. Okay. Okay, you did a great job. Everybody said that B is correct. Yes, this is true. ATP is produced. Only two ATP molecule is produced by anaerobic glycolysis. But if it's aerobic glycolysis, 36 ATP can be produced by glucose breakdown. Okay. Question 13. Go ahead. B. D. B. Okay. One group, group 7, said D, question 13D. Group 7, Achimad, why you selected D? Could you tell me what kind of discussion you made? What discussion was made? Okay.
Yeah, Prof.
Yes.
First of all, I'm sorry if my answer is incorrect. What I know is glucagon hormone is the one that decrease the glucose level in blood. So my group is the answer of my group is glucagon.
Okay. Please keep in mind that glucagon can break down the glycogen, causing a release of glucose from liver to the bloodstream. So glucose level can be elevated by glucagon secretion. Okay? So in the other hormone, growth hormone can also elevate glucose level, and cortisol also can elevate glucose level, and thyroxine is also actually elevate and decrease glucose level. Thyroxine can stimulate breakdown of glycogen. So transiently, it can elevate the glucose level. So GLP-1 can stimulate the insulin secretion. So GLP-1 is the correct answer. Okay. So question 14, go ahead. Question 14. Wow. Hmm. Okay. Okay. Most group answered E, but some group said B. Okay, group 16. The answer is B. Why do you think so? Wianda, could you tell
Yes,
me?
Professor.
Yes, yes.
Uh, uh, so our group decided that the answer is B because on diabetes type 2, there is a lack of sensitivity on the insulin receptor. So the cell cannot absorb the glucose. So the glucose is in the bloodstream. So we decided to, because the absorption cannot happen, we decided that the answer is B.
Okay.
Yeah, Professor.
Okay, nice. Okay, nice discussion. Yes, type 2 diabetes, of course, sometimes insulin sensitivity decreased. That is correct. But you have to think about the main target organ. Main target organ is liver, adipose tissue, and skeletal muscle. It's three major target organ. And the kidney is, of course, insulin may act at the kidney also, but the kidney may not be very sensitive to insulin. So glucose reabsorption could be decreased, but this is not the main reason why glucoseuria is caused. So the main reason is glucose in urine as filtrated by glomerulus is too high. So glucose cannot be reabsorbed fully reabsorbed from the tubule. So the E is correct answer. Okay, the final one. Type 1 diabetes is caused by which? Go ahead. Question 15, go ahead. That interesting. That interesting answer. Oh, this is very interesting answer. Okay. Well, answer. Well, it's really interesting. Wow, that's very interesting answer. Okay. Some group selected B, some group selected C, some group selected E. So okay, instead of asking questions, I'll tell you a little bit. Okay, type 1 diabetes. Of course, there is some genetic influences, but many type 1 diabetes is caused by autoimmune mechanism. For example, some kid got infection, then virus can infiltrate into islet. Then their white blood cells or lymphocyte can react to attack the beta cells, causing the complete loss of beta cell. So genetic defect could be involved, but this is not the main reason. Okay, and the answer C, decrease in beta cell function. This can be sometimes seen in type 2 diabetes. And if you know or not, I don't know, but genetic influence is stronger with type 2 diabetes, not type 1 diabetes. Okay, so the answer is complete loss of beta cell is answer. But okay, do not consider that type 1 diabetes is caused by the heredity. This is the thing that you should not tell to your patient. Okay, your patient may be very sad. Your mother, the patient parent is going to be very sad if you say, oh, type 1 diabetes is caused by the genetic defects, so it cannot be cured or something like that. If you say that, the parent will be very sad. So don't say that. Okay? All right. So, well, we are greatly behind the time, behind the schedule, but maybe we can. Prof. Irfan, you think it's better to take a 5-minute break?
Okay, if you said so, it's okay.
Or I can just show the clinical case, then
yes,
the student can take a 5-minute break and start the breakout session maybe, or give the lecture. Yeah, maybe 5-minute break.
Okay, 5 minutes to toilet break, I think.
Yeah. Okay, 5-minute break. Okay, it's very interesting, right?
Yes. And I do not realize that your student is can answer a lot of the questions. Good one.
Yeah. Anyway, that's good.
So the backgrounds for the student is Sakura and Kyoto Shrin.
Yeah.
Puji.
Yeah. Okay, so I will send the clinical case to student.
Boleh kalau mau istirahat ya, toilet ya.
Okay.
5 menit.
Okay, student, you can download the today's case. Okay, I would go to toilet as well.
Enak, aku kirim ke kau ini. Tulisan tadi. Sederhana, tak usah banyak-banyak. Dekan ini. Bikin ukuran berapa? Separuh kalau yang kertasnya 1 bak. Kalau yang kita cetak print dulu kita print.
So can we start at 10:45?
It's done. Please share your. Okay, you can start.
10:45 maybe? Yeah.
Yes.
At first, I will show the case. Then after my explanation, breakout session, next breakout session will start. Okay.
And open.
So everyone, please download the case. Okay. So if everyone is ready, we can start the next session. Okay. So the today's clinical case is type 1 diabetes mellitus. So you have already had the knowledge about type 1 DM. So a 15-year-old boy was recently diagnosed with type 1 diabetes mellitus. He was an excellent student and had many friends, but before diagnosis, he had worried about the several symptoms that he experienced for 4 months. So, but he did not tell everyone. So no one knows except him. But one day, at sleepover in his friend's house, the unimaginable happened. He wet his bed, so he peed in the bed during sleep. Until this tragedy, he had not told his parents about symptoms he was having, but he was constantly thirsty and was urinating every 30 to 40 minutes. Furthermore, despite a voracious appetite, he seems to be losing weight. So the weight is getting lower and lower. His parents panicked because they knew that these were classic symptoms of diabetes mellitus. They took him to see his pediatrician immediately. So what they found is height is 169.5 centimeter. This could be a little bit higher than average of Indonesian, but probably for Japanese, this is kind of average, or maybe a bit higher. And weight 45 kilogram, but the body weight decreased 4 kilogram in 2 months. And blood pressure, this and that. You may not know, or you may know this is normal or average or lower or higher. You have to decide. And the fasting plasma glucose is 320. Normal is 70 to 110. Fasting C-peptide, you have to understand what C-peptide is, but this is lower than normal. Plasma ketone, 1 plus. Usually you cannot detect the ketone in plasma. And urinary glucose, 4 plus. This is also very high. Urinary ketone, 2 plus. This is also very high. So all of these findings were consistent with a diagnosis of type 1 diabetes. So he immediately started taking injectable insulin and learned how to monitor his blood glucose level with a finger stick. Okay, so you can measure glucose using a finger stick. Okay, so question. So group discussion. How did insulin deficiency lead to an increase in his blood glucose concentration? Okay, how did insulin deficiency lead to the finding of ketones in his blood and urine? Why did he have glucose in his urine? Why did he have increased urine production? Why was he drinking so much? Why his blood pressure lower than normal? Why did it decrease further when he stood up? He takes his insulin by subcutaneous injection. Why can't he take insulin orally? So these are I would say this is a little bit easy questions for Japanese. Usually, Japanese students usually regularly take TBL class. So this is, but this is your first time to take TBL. So the question is slightly easier than we usually do. But I hope everybody can give me the correct answer or appropriate answer. Okay. So you can start discussion again.
Okay. So the room already open. Please jump to your same rooms. Excuse me, Prof. Nori, for how many? What time we will go back to 50, 60? So discussion will be 50 minutes. Untuk para fakulti ya, discussion time is 50 minutes. 50 minutes. So we will be back at the main room in 10:40, 11:40. Nadira ini maksudnya 12 ya. Habis sudah. Penny masuk berapa Penny ini? 6 ya? Penny ini mana berapa? Hah? 5 Penny ini. 5. Siswa masuk ke mana? Siska? Siska masuk mana? Hah? Siapa nak join ini? Tok, titik-titik ni siapa nak join tu? Hah? Siska 4 ya? Hilang tak? Hah? Masuk ke mana dia? Bukan penyusup, mungkin dia tu cadangan dia kali. Iya, cadangan dia kali. for the group who has the answer in Indonesia, while we waiting for the main session, please translate it in English. Because maybe some of you will be present, asked by Prof. Nori to present the answer, so please make it in English. Yeah, you can use Google Translate, it's okay. Ngapa hilang lagi tak ni tak ya? Oh, dia aku berlari Tak bisa buat ini tak
Okay, so we have only 1 minute left. Yeah, Prof. Irfan, probably have only 1 minute left. Yeah, no, for the first breakout room, they spent too long time, so probably we have to finish. Yeah, we have to finish exactly. Yeah, exactly at 50 minutes. Yeah.
Okay, I will push them to go the main room. I will close the room in next 1 minute.
Yeah.
Room 1 still discussion. I see this. I'm seeing now. Okay. Room 1, room 2 still complete. Room 5, room 4, room 6. All of them mostly. Okay, we already have 6 groups going to the main room.
Yep. Okay, time is out. So
okay,
please ask them. Yeah.
Okay.
Yes, please.
Okay, I close the all room.
Yep.
Okay. So everybody, I'm so sorry that I have to push you to the main room because the time is up. We have to go to the main discussion.
Dipaksa kembali nih, Dok.
We have to push it because of the time.
So as before.
Yeah. Otherwise, you guys do not have a time for lunch.
Yes.
You know, because you guys spent too long time for the first discussion session. It's twice as much as we expected.
Okay. Okay, Prof. Nori, you can continue now.
Okay, so everybody's here. Okay. So from the beginning, so we can start the discussion session. Okay. So I will randomly ask questions to all of you, and the answer is we understand the answer. Your answer could be the answer of the group. So if your answer is good, you can get a good score. All of the members of a group get a good score. But if your answer is well, so-so, the score is so-so. Okay, don't worry about making mistake. To know about the process of discussion will be much more important. So you have to tell me the reason why you decided, why you made such kind of conclusion. Okay. Question first, how did insulin deficiency lead to an increase in blood glucose concentration? Okay, I will assign group 2, group 12, Nadira, group 2 Nadira, group 12, group 12, group 12.
Kelompok 12.
Nadira.
Bahasa Indonesia diganti dulu bahasa Inggrisnya nanti ya.
Nadira Alifa Mutaifan. I cannot hear you.
Nadira, group 12.
Group 12, Nadira.
Kelompok 12. Group 12, which means that Nadira Alifa, Sabina Safira, Srifa, consider, please give your answer for number 1. Srifa and Aristo.
You wanna pass?
I'm afraid they are trying to translate it in English, maybe, Prof. Nori. Maybe for the first question, maybe you can ask for the group 1 until number 8, because they already written it in English.
Okay. If so, I will move on to the group 1. Okay. Justian.
Yes, hello, Professor.
Okay. Answer for the question 1.
Okay, I'll try answer with from our group discussion.
Yep.
So according to our group discussion previously, we know that the function of insulin, the increase the secretion of GLUT4 transporter, which is for the increasing of glucose uptake of the cell. So if there's a deficiency of insulin, it will lead to decreasing of uptake of the decreasing of glucose uptake of the cells, which will lead to an increase in his blood glucose concentration.
Okay, so you say that you mean that decrease in GLUT4 in the membrane can inhibit the glucose uptake, right?
Yes.
Okay, so 2/3 correct. Not 100%. Not 100%. Okay, so the GLUT4. Okay, GLUT4 can function as the glucose uptaker, but GLUT4 is not expressed in liver. GLUT4 is not expressed in liver, but as I told you, insulin action is greatest in liver. Why, apart from GLUT4, why glucose can be uptaken in liver? Okay, group 4. Adila.
Yeah, Adinda. Group 4, representation of group 4. Adila, Adinda.
If you cannot find the answer, just tell me. But if you have additional answer in addition to group 4, just tell me. Adila, you hear me?
Yes, Professor.
Yes.
So from the previous discussion with my group, actually we don't really find the corresponding to the GLUT4, but insulin for the first question, our answer is because insulin is used to maintain blood glucose level by giving a signal to the liver and muscle to take up the glucose and store it as a glycogen. But because the deficiency of insulin in the blood, it can cause the high level of blood glucose because it cannot turn over into the glycogen.
That's good hint. Oh, it's good hint. So that's very nice answer actually. So in liver, insulin can increase the glycogen synthesis, right? If so, what's going to happen if insulin is deficient in liver? Can you guess, Adila? What's going to happen? Glycogen synthesis.
The glycogen synthesis will be disturbed because there isn't any insulin who do it.
Right, exactly. So if blood glucose level in the cell is high, what's going to happen of glucose uptake? Can you guess? Sorry, Adila, for asking long question. So you said that the insulin, deficiency of insulin can inhibit glycosynthesis, right? So cellular glucose level will be keep high. So there is no deficit of concentration gradient between outside of the cell and inside of the cell. Everybody understand what I'm talking about? Okay, so in liver, glucose is uptaken through GLUT2, not GLUT4. Okay, in liver, GLUT2 is responsible for insulin uptake. And uptake is mediated through concentration gradient. Concentration gradient. So if insulin is absent, cellular glucose level is very high, which disrupt the concentration gradient. So the uptake of glucose is inhibited. So a lot of glucose can be released into the circulation and increase the blood glucose level. So in summary, there are two mechanisms. In muscle and adipocyte, GLUT4 may play a major role in glucose uptake. But in liver, glucose is uptaken by GLUT2, and the insulin can increase the glycogen synthesis, therefore constructing the concentration gradient. Okay? So this is the answer of the question 1. Okay. And I would like to share some basic idea, because I was supposed to give a lecture after the discussion session, but unfortunately our time is limited. So I need to tell a little bit about the insulin and glucagon action. So you have to remember, I'll upload this file after this class, okay? So you can download later. But there is 3 major target organ in insulin. One is liver, the other adipose tissue, and the other is skeletal muscle. These are 3 major target organs of insulin. And important thing is there is a slight difference in the mechanism of glucose uptake in adipose tissue, skeletal muscle, and in liver. So the first primary thing is glycogen synthesis in liver, which increase the concentrated gradient. Okay, and in adipose skeletal muscle, on the other hand, glucose uptake is activated by GLUT4. Okay, but not only liver, but also skeletal muscle, glycogen is synthesized, right? And in liver and skeletal muscle, protein synthesis is also increased. And in adipocyte, actually lipolysis is inhibited by insulin. So there is a slight difference in insulin action. Okay, unfortunately, I don't have enough time to talk about the glycogen. So I just focus mainly on insulin. But please keep in mind, insulin not only act in the glucose system, but also it acts to protein and triglyceride synthesis. Okay. All right. Okay, I'm going to move on to the question 2. How insulin deficiency lead to the finding of ketones in his blood and urine? Okay, I'm going to move back to the group 12. So interpretation finished. Nadira? Okay, so tell me why ketones are increased.
Itu
I cannot hear you.
Group, which group, Professor?
12.
12. Okay, please. Group
Nadira.
Nadira. Hello, Nadira.
Hello, Doctor.
Group
Okay,
12.
please answer your question.
How did insulin deficiency lead to the finding of ketones in his blood and urine?
Ketones are produced when the body uses fat as an energy. So,
yes,
ketones from when there is not enough insulin to help your body use sugar for energy, body begins to break down fat in the liver. Ketones can normally be metabolized by the body, but increased production leaves excess ketones in blood and urine.
Yes, excess ketone can be found in the urine, but how ketones are increased by the absence of insulin? Can you guess? Okay, anyone in group 12 can help her? Anyone in group 12 can help her? How ketone is increased in blood? How insulin deficiency can increase the ketone? Anyone in group 12 can help her? Otherwise, she's going to be isolated. Not really? Okay, I'm going to move on to other group. Okay, group 19, 3, 11, Novanti, group 19.
Yes, Professor.
Okay, could you tell me the mechanism how ketone is increased in blood?
When there is a lack of insulin, GLUT4, which function for glucose intake into cell, is destroyed as a result of which glucose is concentrated in plasma. Glucose that cannot enter cell can be used as energy or stored as energy reserves in the target organ. So because glucose cannot enter cell due to insulin deficiency or low insulin sensitive, the body reacts to meet its energy needs by using protein reserves. When protein reserves run out,
fat reserve will be used, but the problems because in the brain there is blood-brain barrier to become fat. It cannot be processed directly by brain, so the body convert fat into a form that can be used by the brain. But because the result of fat conversion in the form of ketone body increase, it will cause ketosis, which cause metabolic acidosis.
Okay, what you talked about is correct, but this does not answer my question, unfortunately. So what I want to know is a mechanism, how ketone is produced. It is a little bit far from glucose metabolism. There was a hint in here. I told you that insulin can produce triglyceride synthesis or inhibit lipolysis. Okay, so triglyceride metabolism can be affected by insulin deficiency. Okay, so apart from glucose metabolism, what do you think happened in adipocyte, fatty acid or triglyceride metabolism if insulin does not exist? Okay, I'm going to move to the group 5. Group 5, Putri, group 5, Putri,
Yes.
Maharani, can you guess the action of insulin on triglyceride metabolism? It's difficult.
Okay, wait. Number 2.
Yes.
Yes. Blood and urine contain ketones because insulin deficiency increase blood level of fatty acid.
Yes.
Which are the biosynthetic precursor of keto acid. Insulin deficiency promote catabolism of all nutrients, including fat. Increasing lipolysis leads to increasing blood level of fatty acid that are converted in the liver to keto acid. Beta hydroxybutyric acid and acetoacetic acid, as the concentration of keto acid increase in the blood, they are filtered across the glomerular capillary and appear in the urine.
Okay, great. Okay, your answer is almost correct. Wonderful. Yes. So the deficiency of insulin can increase the lipolysis, okay, causing a large amount of fatty acid. Then fatty acid is then oxidized, right, to produce ketone because here, okay, fatty acid catalysis can produce a lot of acetyl-CoA, right? Then usually if the level of acetyl-CoA is not so high, it can react with oxaloacetate and cause citrate, right? However, if beta oxidation of fatty acid is dramatically increased by the deficiency of insulin, then there's a huge amount of acetyl-CoA is accumulated in liver or adipocyte. So the compared to the level of oxaloacetate, acetyl-CoA become very high, causing the production of ketone body. Okay, so increased catalysis of triglyceride can cause ketosis. Okay, everyone understand? Any questions about that? This is a very important point. So what I want to emphasize is not only glucose metabolism, but also lipid metabolism is also affected by insulin deficiency, causing ketosis. Okay? Any questions? Are you sure? Everybody understand? Your teacher will give some exam after this session.
Yes, we will give the exam.
Okay, anyway. All right. Okay, question 3. Why did he have glucose in his urine? This is, I already told you during the question answer session. Okay, group 14, Maya, Trianda.
Kelompok 14, number 14.
14, question number 14, group 14.
Group 14.
Maya, Trinanda.
Halo Maya.
Maya, Halimah, silakan.
Maya, tell me.
Prof.
Yes, why this guy had a glucose in his urine?
From my group in discussion, the answer is glucosuria is a disease when there's glucose in the urine. This condition usually happens because diabetes mellitus. So in DM type 1, the secretion and production of insulin is decreased because some reasons like destruction in beta cell or the complete loss of beta cell.
Mm-hmm.
As we know, insulin holds the important role when the blood sugar level is high. In the M1, the production of insulin is decreased or completely can even make insulin. Because of that, the glucose in the blood can be absorbed to liver or other muscle to be saved. So our body will produce more glucose using glycogenesis or gluconeogenesis because there's a signal that the body lacks of glucose to be used. That condition will make hyperglycemia. If the glucose concentration in the blood is high, the kidney won't be able to reabsorb all of the glucose. Then the glucose will go to the urine. Thank you.
Sorry, I did not understand quite well. Why it is too long that you have too many additional information. So to make your story short, what is the main mechanism to cause the glucose in the urine? I'm not expecting you to read the textbook. Just tell me why this patient had glucose in his urine.
Kalau ada yang lain yang bisa bantu di grup yang sama, silakan.
Someone in the group?
Ya, silakan, ayo.
Yeah, answer the question. I have already told you some hint during the first study session. Anyone in group 14 can answer the question? No?
Professor, may I
Yes.
answer the questions?
Yes, please.
Yeah, well, it's because because the glucose in blood is too high, so that the kidney won't be cannot absorb it, won't be able to reabsorb it. So it is a compensation through the urine. That's why the glucose will go through the urine? It is the simple question, the answer for that.
Yes, yes, yes. Actually, yes, exactly. So, so this is the mechanism of high glucose urea, because with the increase in blood glucose level, amount of fetal glucose is increased with the increase of blood glucose level. And at first, this was observed in the renal tubule, but there is a threshold, there is a limit of observance. So if the urine, glucose in urine become higher than the limit, then all glucose can appear in the urine. Okay? So such kind of limit, this is what called reabsorption threshold, because of this reabsorption threshold, glucose can appear in urine. Okay? Everybody understand? Any questions? Okay. So the fourth question is, so urine production is also increased, right? This is what we call polyuria. So why he had increased urine production? Okay, I'm gonna move on to the other group, which is okay. Okay, maybe I can ask some Japanese colleague. Group 6, Yukiko, you answer?
Yes.
Okay.
Number 4, right?
Yeah, yeah.
Okay. I think it's because the cell like cause like heavy hydration, because I know, sorry, I was talking about the polydipsia, why he was drinking so much.
Could you give me the answer of polyuria first?
Sorry.
Polyuria.
Okay.
Why did you have increased urine production? Okay.
It's because the glucose increased the osmotic pressure, so it increased the urine production. I think that is okay.
Okay, yeah. Not 100% correct, but the basic essentially is correct. Right. So remaining glucose can increase osmotic pressure of the urine. So again, the osmotic gradient is necessary to uptake of water from renal tubule to interstitial area. So increase in osmotic pressure induced by remaining glucose can inhibit the water reabsorption, so causing polyuria. Okay, wonderful. Okay, so polydipsia. So polyuria may cause polydipsia. Why? Okay, I'm gonna move on to the okay, group 15. Hanifa, Fadila, Putri, group 15. Can you tell me the cause of polydipsia? Why he was drinking so much?
Yes, sir.
Yes, go ahead. Why
Under normal circumstances, sorry, sir.
Yep.
Under normal circumstances,
Yep.
the kinase will reabsorption the entire glucose. High blood glucose level causes all glucose to be dissolved. As a result, osmotic pressures in the renal tubules will remain high so that it will inhibit the reabsorption of water by peritubulus.
Yes, this is
Water
polyuria.
will continue to come out in large quantities in the form of urine. High glucose level compensate with a lot of urine, a lot of water is extract need to drink.
And so why was he drinking so much? Up to here, what you're saying is correct. So why he feels thirsty? Why he drinks so much? Anyone in group 15 can tell me?
Yang lain grup 15 bantu, Hanifah.
Anyone in group 15 can tell me? Okay.
He is dehydrated.
Yeah, dehydration. Because too much urine, right? Yes, too much urine called dehydration. So so that's why they become thirsty. And the increase in osmotic pressure caused by high blood glucose could also the reason why they feel thirsty. So there must be two reasons. One main reason could be the dehydration induced by the polyuria. Okay. Okay. Question number 5. Why was his blood pressure lower than normal? Why did it decrease further when he stood up? So this is a little bit different from the endocrine physiology point of view. But okay, we can ask. Group 2, Afaf? Afaf?
Yes.
Okay, go ahead. Yes. Why was his blood pressure so low?
Afaf di unmute. Okay.
Okay, Prof. He takes his insulin by subcutaneous injection. Why cannot he take insulin orally? I want to answer this question. Is he lost many water and natrium, so the extracellular fluid volume decrease, making his blood volume decreased, results in decreasing blood pressure.
Okay.
Decreasing blood volume can impact decreasing blood in venous return to the heart which lead to decreased cardiac output and decreased arterial pressure. Pressure decreased further when he stood up. Orthostatic orthostatic hypotension because as blood flowed in the vein of the legs, venous return and cardiac output were compromised further.
Okay. Basically, it's correct, but you need not use a medical terminology. Just because the gravity, blood stays on the lower part of your body when you stand up, so causing a decrease in blood pressure. Okay, of course you say orthostatic hypotension, but at the moment you need not to learn the medical terminology. Rather, you have to tell us in using your word, the reason. Okay, anyway, what she said is correct. Okay. Okay, move on to the question number 6. He takes his insulin by subcutaneous injection. Why can't he take insulin orally? Okay, which group has not been answered yet? Okay, group 9. Laddie. Group 9. Laddie, Olelia. Laddie, can you hear me?
Yes, Prof.
Okay, tell me. Question number 6. Well, someone in group 9 can answer this question?
Maybe Reza will explain it, Prof.
Okay.
Okay, so maybe I think when we discuss why insulin cannot be taken by orally, it's because insulin is a type of peptides which is if you administer it via orally, it will be digested by the gastrointestinal cell.
Yes, that's true. Insulin is a peptide hormone. So insulin can be break down in the digestive juices, such as pepsin, trypsin, or whatever. So even if you drink the insulin, you cannot act. It cannot be absorbed. But in other cases, sometimes you can take orally. Do you know? Is anybody knows which hormone can be taken orally? Some hormone can be taken orally. This is a little bit outside of the questions that I gave you. So anyone who can answer this question, tell me. Some hormone can take orally. Which kind of hormone can take orally? Anyone? Answer? Don't be shy. Some hormone can be taken orally. Anyone can answer?
Excuse me, Professor, may I answer the question?
Yes, sure.
Okay, is it the steroid hormones like estrogens?
Yes. Okay. So not only estrogen, but also most steroid hormones can be taken orally. Okay, because these are lipophilic, and it is not easy to catalyze, and also the molecular weight is very, very small. So lipase is nothing to do with the catalysis of these hormones. So estrogen, progesterone, androgen, testosterone, and also thyroid hormone can be taken orally. Okay, we have 20 minutes longer than expected. And actually, I wanted to give a little bit more about that, give you more questions, but unfortunately, the time is limited. So I'll send my slide, I'll upload my additional information. You, where is it? Whoops, sorry. I lost.
Ini sudah presentasi.
Just a second. Something is wrong. Okay. information? Where is the additional information? Where is it? Okay. Okay, I have uploaded the additional information about the type 2 diabetes, sorry, not type 2, sorry, type 1. Sorry, I made a mistake. Type 1 diabetes, additional information I uploaded. So you can check out the information and the self-study again. And I hope that I can see you again in the future.
Yes.
Both, maybe in Japan or maybe in Indonesia. And
Yes.
I hope you enjoy the first TBL class.
Yes.
Next time, by the time you receive the TBL next time, you have to self-study and you have to learn how to answer each question orally. Okay. Any other question, comment?
Okay, please give one comment for Prof. Nori and for the system or for the methods that we have done today.
Yeah.
Maybe one comment from a student from Sriwijaya and one comment from student from Gunma.
Yeah.
Hope
Okay.
so.
Good.
Okay, please. Ayo dari Unsri silakan ngomong dulu, nanti dari Gunma kita minta satu. Ayo.
Okay.
Please.
One
Siapa
comment
nih?
from Sriwijaya. Anyone? Any volunteer?
Okay. Ya, silakan. Ya, Arkan. Okay, please Arkan. Give your comment.
Mirah, Dok.
Oh, Mira. Okay, please.
Okay. So.
Ayo, come on, Mira. Okay, Mira is okay. Arkan is okay.
Okay.
Mira plus, okay. Mira, please. Oh, Mira, give the please, Mira.
Okay, thank you, doctor.
Mira, can you show your face?
I'm sorry, doctor, but my laptop camera is broken right now. So yeah.
Okay.
Pardon me. Okay, thank you, Professor. So I want to ask a question before regarding your question about hormones that can be taken orally. So I've read an article which said that steroids hormone can be taken orally by mouth have been linked to liver disease. And steroids taken by injection can increase the risk of infectious disease such as hepatitis or AIDS. So I'm kind of confused of this information, Professor, because you said that steroid hormones can also be taken orally. So may I have your thoughts about this matter, Professor? Thank you so much.
Well, I think you a little bit got confused, and it doesn't matter whether steroid can be taken up orally or by injection. Both of them can enter into the bloodstream, but there is one difference. When you take orally, some steroid can be catalyzed in liver. However, still many steroids can enter into the bloodstream, acting in the same manner. Okay, but there is a side effect of steroid. I mean cortisol. Large amount of cortisol can inhibit the immune system. So this is the reason why it may cause the infection. But it doesn't matter whether this is uptaken by the orally or received by injection. Okay. Any other comment from 3 students about the? Yeah. Okay. Any other comment?
May I give a comment?
Yep.
Okay.
Arkan, please give your comment.
Pardon?
Go ahead.
Yes, Arkan, please give your comment.
Okay. So first of all, I would like to thank Professor Nori and all fellow Japanese friends for giving us the opportunity to introduce us to TBL system. I think it's very similar to what we do here. So we are given scenario and we have to study from it. except that in this time we were given the questions which for me is more convenient. I liked it. And I'm really happy to meet new friends from Japanese. I really hope that we can, I hope that the breakout room was, I hope we have a longer time in the breakout room. And we are really glad to show hospitality to our Japanese new friends. I think that's all. And thank you very much.
Okay. Okay, Arkan, did you have already changed your phone number with your friend? Change your phone number.
We can get to that later, I guess.
Okay. So
Nowadays Instagram, Dok.
Yeah. Okay.
Anyone from the Gunma University? Any volunteer?
Yeah. Any volunteer for Gunma? Please give your comment.
Anyone? Anyone is fine.
Yes. Oh, Ayane. Okay, Ayane, please give your comment.
Is it okay to suggest a comment?
Yeah.
Not a question. Actually, I worried both about English and physiological knowledge, but everybody welcomed me and everyone was so kind, and I had a really happy time.
Wonderful.
Experience.
Okay, Ayane. Don't forget chicken.
Okay, thank you very much, everybody, and I hope that you enjoy the TBL class. Yeah. Okay, so I hope to see you again sometime in future, and I also appreciate greatly for the teachers and Unsli for helping me. Thank you very much.
You're welcome, Professor. So,
Okay.
Thank you, Prof.
Okay. Okay.
Bye.
Okay, bye.
Ayane, don't forget to buy a flight to Indonesia, yeah?
Okay. Okay.
Welcome you in Indonesia.
Yeah. Okay.
See you.
Thank you so
Okay,
much.
Prof. We will meet again at
See
2
you.
o'clock
Thank you, Prof.
our time. Okay?
Okay. So I will just, so Prof. Irfan, I will just shut down first, and then for the afternoon session, I will log in again.
Okay, Prof. Nori, if you don't mind, we can make it earlier if you want.
Yeah.
1:30 is okay for us.
Sure.
Still have time, 1 hour time to take rest.
Yeah.
And so we can invite our student at 1:30, so we can start at 1:30.
Okay.
It's okay?
Sure.
It's been at 1 hour from
Yeah.
time. Okay.
Okay. Talk to you later again.
And in 1 hour for the teacher, for the faculty, so for the student. Thank you for you all. Please take a rest for a while. Yeah. Have a great time. Bye-bye. See you.
See you. Okay. Bye. Okay, I'll get out.
Thank you, Professor.
Thank you.
Thank you very much, Prof.
Thank you.
Thank you, Professor.
Share lewat WA, share
Jadi udah bisa live ini, Pan?
Untuk presentasi. Untuk yang kemana yang dulu? Itu lagi, habis ini ujian Dias. Oh, bisa sore ini. Demo.
Cukup.
Itu bagaimana? Hah? 1 hour ya, dia tahu budak-budaknya 1:30 step lah. Ini jam 1 kurang. Ini boleh.
Sesi 2 siang ya, Dokter Budi?
30
Jam 1:30.
Ya, oke.
Oke, untuk
Lift dulu enggak apa-apa ya?
Iya. Nanti masuk pukul 2 ya, kayak sesi siang. Yang sesi 1 ini nanti ada link yang baru masuk kelas praktikum pukul 2. Ya.
Untuk yang sesi 1 sudah tidak ada jadwal lagi, Dok?
Praktikum tadi praktikum.
Izin bertanya, Dok.
Belum, lagi diantar.
Dokter Budi izin bertanya.
Ada Yos, nanti join.
Nanti ada praktikum, Yos.
Ya, jam 2 ya. Pukul 14 nanti praktikum. Nanti linknya saya kasih di grup WA. Oke ya.
Oke, baik. Terima kasih, dokter.
Nah,
Hello, good afternoon, Prof. Nori.
Hi, good afternoon. So we can start at 1:30 as we scheduled.
1:30 is okay.
Okay,
But
sure.
let me count the student first because
sure.
we announced them that 2 o'clock, but we already have a new announce.
Okay.
All of the students realize that they have
okay.
in 1:30.
And we really have to restrict the time of discussion.
Okay,
right?
okay.
Particularly for the first discussion session.
Yes.
Because they discuss too long.
Yes. Okay.
So then probably we can finish on time.
Yes, okay.
Okay. And I already uploaded the IRAT question.
Okay, okay. Tolong dihitung. So the IT team still counting the students. Is it already complete or not? Sudah. Tapi masih 120 itu dosennya dok. Berapa semuanya? Hah? Hah? Group 1 is still 1, 2, 3, 4. 1, 2, 3. 1, 2, 3, 4. 4 toh. Group 1 just 4. Group 10 still not complete. 11 is okay. 12 is okay. 13 toh. Ya, minus. Baru 5 just 5, 6, 7. 13 still not. 14 no. No one, only 1 in 14.
Group 3.
Is okay. Number 3. Only 4. 4 is okay. 5 only 5. One, 2, 3. G. Please. Oh, they have G here. Coba dirubah Rea. Rea Amelinda rubah angkanya. Grup berapa Rea? And then Dian, please just write the 19, not A. Rian, ya. Dian Dwi Magira, hilangkan E-nya. Ya. Ganti nama ya. Rea Amelinda ganti grup berapa? G. Berapa tak? Yang bilang tak? Berapa kali-kali? Satu, 2. Dira, please add your group number. Dira. So we can spot you different with the teacher. 9? Berapa? 117. Kurang? Ya, 3. we have left 3 students left from Nori. Is it okay? We start. Hello, Prof. Nori still mute.
Yes, I'm here. So you can go if it's okay.
Okay, we have 2 students left.
Okay.
Let us join. We start now.
It's up to you.
Okay. Coba. Jam berapa? Okay, I think we can start. We said we can start now, Prof. Nori, please.
Yes.
Okay. Everybody, good afternoon. So today it is our special session. Today, this afternoon, we have our distinguished professor, our guest professor, Professor Noriyuki Koibuchi from Gunma University. As we have announced to you that today Professor Nori will give his experience and knowledge with a special method. We call it team-based learning. So we have sent to you the number of groups. Please write down your number of groups correctly, and then please pay attention and join this moment with happiness. Yeah. So so you can receive a good knowledge from Prof. Nori. Okay, Prof. Nori, please take your time. We start now. Thank you.
Okay, thank you very much. Hi, everybody. I say selamat malam. Okay, I am Professor Nori Koibuchi from Gunma University, and it's a great pleasure to see you here. Actually, I was supposed to visit your university this year, but I cannot because of COVID-19. So instead of visiting you, I will give you some lecture online. Okay, before I start my lecture, I'll briefly introduce about Gunma University. And I understand that some of you may not be able to understand English very well, so I try to speak slowly. But if you do not understand what I'm talking about, please tell me that I'll try to speak slowly. Anyway, okay? So, okay. So this is, I'm sorry, this is a Gunma University where I'm living right now. Gunma is located in the middle of Japan. And somebody said that Gunma is kind of belly button of Japan. So it is about 100 kilometers north from Tokyo by bullet train, north from Tokyo. And we have a lot of national park inside the Gunma prefecture. You can enjoy skiing in nearby mountain, and we can enjoy very beautiful foliage in the mountain, and we have very beautiful lake. And also you can see here, and this is the hot spring, and you can bathe in the very huge hot spring here in Gunma, although you have to be naked in front of others. We have a lot of festivals. Such we have a very big firework, and we have a old samurai costume festival, or we have some summer dancing festival, and also we have a close connection with South America, and we have samba carnival as well. And this is the Gunma University Graduate School of Medicine, which is located in the middle of Maebashi, which is the capital of Gunma Prefecture. And our university was founded in 1943 as Maebashi Medical College. Right now, we have transformed the School of Medicine, Graduate School of Medicine. So our university is considered as a research-oriented university in Japan. So this is a part of the hospital, part of the photograph of the Gunma University. We have a university hospital which have 700 beds. And this is the main gate. And we have a lot of imaging tools like such as PET, SPECT, and MRI. And particularly, we have a heavy metal ion therapy center in which cancer patients receive the heavy metal ion therapy. And only 3 universities among the world have this heavy metal ion therapy center. So we are very proud of it. Of course, we have a lot of training facilities, such as this is skill lab training facility. And also we have more than 40 research laboratories, and we have roughly 5 publications per year, which include Nature, Science, Lancet, JBC, Cancer Research, Blood, Endocrinology, etc. And hopefully someday you can visit our university and maybe involved in some research if you wish. Okay, and this is my self-introduction. My name is Noriyuki Koibuchi, but the people call me Nori because Noriyuki is too long, even for Japanese. So I was born in Maebashi and grown up in Hitachi, Ibaraki Prefecture. And the Hitachi is, probably you have heard about the Hitachi because Hitachi is a big electrical company which was born in this city. And my present position is the professor and the director of the department of, excuse me? Oop. My present position is a professor and director of Department of Integrated Physiology, Goodman University Graduate School of Medicine. And my research specialty is endocrine physiology and environmental physiology. And my clinical specialty is endocrinology and metabolism, and I'm a registered diabetologist. I used to work in Harvard Medical School, and sometimes I take some of my students to Harvard and give a clinical clerkship. Okay, so today what I'm gonna give you is a team-based learning. So team-based learning is a small group learning that emphasizes student preparation in the class and application of knowledge in class. Students are organized into diverse teams of 5 to 7 students that work together throughout the class. Students should prepare by self-study prior to class. So you have experienced PBL. PBL will, you have to find problems by yourself. But TBL, the objective is very clear. I can give you the question I can give you directly the question to you. So you can utilize your knowledge and summarize your idea to answer questions. Okay? So we will give you that brief introduction, which is now going on. After that, I will give you 10 minutes so to answer questions. So I already uploaded today's test. So you can download through chat. So you can, I will give you 10 minutes. So you have to solve question by yourself. After that, you have to do group discussion for 20 minutes. So breakout session will start here. Okay?
Okay.
Then after that, we will do the study session. This should be 20 minutes. And also group discussion should be restricted for 20 minutes. Okay? In the morning session, students spend too long, and actually we spent 40 minutes for the this group discussion, but this is not what we should do. Okay? We will strictly restrict the time of discussion only for 20 minutes. So you have to answer all questions in group in 20 minutes, okay? And then after that, I will give the case presentation and group discussion again, and the study session, and brief summary and conclusion. So whole series will take about 3 hours if you do very well. Okay. So,
ya.
okay.
Jadi tolong di-download itu soalnya sudah diberikan Prof. Nori via chat ya. Kemudian baca dulu 10 minutes from now. You have to try to answer by yourself for 10 minutes from now.
Yep.
Then you can go to a break room after that. And remember that on the break room, It's only 20 minutes, no more than that. Okay.
Okay. Go
Please
ahead.
Please for the faculty member to remembering the student in the discussion group, just discuss no more than 20 minutes. Terus adik-adik nanti sambil mencari jawaban soalnya. Nanti kalau diskusi boleh bahasa Indonesia ya. Tapi usahakan kalau ada beliau nanti begitu masuk, beliau akan keliling ya di break room masing-masing. Usahakan kalau lihat beliau bicaralah bahasa Inggris ya, paling tidak campuran lah gitu ya. Oke. Mungkin dosen pendamping bisa memberikan pemberitahuan ya kalau beliau masuk bahasa Inggris gitu, biar beliau mengerti kira-kira apa yang didiskusikan ya. So Prof. Nori, I try to tell them that it's better to use it in English, but if you cannot, okay, you can mix it with bilingual.
Yeah. Well, I do not understand any Indonesian. You have to reply me in English. Okay. You could do the discussion in Indonesian, of course, but all answers should be in English.
Yeah.
Okay.
Sudah dicatat dong menitnya. Halo dok. Iya. Iya. Hello, Prof. Nori. Hello, Prof. Nori.
Yes.
While we waiting for the student to answer by themselves, Dr. Adrianta asked me to join with Zoom, so I let him to go into the Zoom.
Sure, no problem.
While others is join with the YouTube.
Yeah.
Okay.
So the test will be finished in few minutes, right? Like a 52 or 53 or something like that, if I remember.
Yeah, okay, yes. In 52, I think.
52, okay.
Okay. Itunya break roomnya. Sudah ya, open be. So adik-adik, breakout roomnya sudah dibuka ya. So you can join after Dr. Prof Nori ask you to go into the break room, okay? So the break room is already open.
Okay, so if you have finished answering the quick test, you can go into the breakout room. Oh, no, not yet, sorry. Before, I have to tell you the rule of breakout session. Sorry, I need to tell them the rule.
Okay. So I close for a while for
Just,
break room.
Yeah.
So somebody has already go into. Okay.
Yeah, I need to tell them. Okay, so I just want to emphasize how we discuss the question. Okay, so of course you have to camera on and disclose their face to the members, and you have to discuss piece by piece and decide which do you think is correct in each question. And please select one representative who will submit the answer upon request. So do not send the answer until I request during the study session. So after discussion, we will have the study session 1. So a representative student of each group send the answer through chat, okay? If all answers are correct, we proceed to the next question. But if different answer comes out, I will randomly ask reasons of each groups, okay? Understand? Okay, so please start. It's almost the time. So you can start discussion session. Yes.
Oke, silakan masuk ke room masing-masing. So we will close the room at 12.
Okay.
12, okay. Dr. Adrianta already.
Okay.
Dr. Adrianta, if you want to join in one group, please select one group. But what Prof. Nori said, it's keep silent.
Yeah, this time I cannot join the group because the student seems to discuss in Indonesian, so I cannot understand. Well, yeah, in the morning session, some group only use English because we have a Japanese student.
Yes.
So I really enjoyed listening to the discussion, but this time it seems that students are using.
But I tell them, if you come to one group, Prof. Nori, So
Yeah.
they have to speak in English.
Well, I don't want to give pressure because they only have 20 minutes.
Yes. Ya, silakan dok. Masuk aja dok. Satu grup. Ah? Itu tinggal join aja dok. Dokter tinggal join aja. Tinggal di breakout room. Tinggal masuk ke breakout room itu di bawah. Dokter Adrianta, kalau mau ngobrol dulu sama Prof Nori silakan. Prof Nori masih di main room.
Yes, I'm in the main room. Actually, I don't know why, but I cannot go into the breakout room.
How come?
I don't know. The icon does not show up.
Sorry. Maybe I was. Okay.
Can I be a co-host right now?
Okay. So I try to. Minta jadi co-host ini. Prof Nori. Co-host ya? Oh, di situ. Oh ini. Ini. Ya, keluar.
Okay.
Okay, you're ready, co-host.
Where is it? I still cannot find out. Oh, here you go. Okay, got it. So some group is discussing in English. No.
Okay.
I'll just take a look. I'll just take a look. Prof Irfan. Prof Irfan. Some student, Prof Irfan, can you hear me? Are you around? Oh, sorry. Prof. Irfan, are you around? Prof. Irfan, are you around? No. Prof. Irfan, are you around? No. It seems that some progress of some student is very slow. I'm afraid they cannot finish by 12:20, 2:20, 2:12. Irfan. Are you sure that you can finish, all of them can finish by
12 o'clock, 14, 12. Okay.
It seems that some of them answered very slowly again.
Yes, but it's okay.
Again,
Okay.
so maybe we need to another 5 minutes.
It's up to you. If you want to, okay for me.
Because I want to discuss for all questions.
Okay,
right?
okay. 5
So
minutes. Okay.
5 minutes. Okay.
So 14, 17. Okay.
Yeah, 14, 17.
Okay.
And could you please ask student to take a look at the chat? Because I time in time send some information through chat.
Yes. Yes, already. I told to
Okay,
them
okay.
by one.
Okay.
Okay, Prof. Nori?
Yep.
We can close the break room.
Yep.
Okay, we close the break room. Yeah.
Okay, everyone, come back. Okay. Okay, everyone seems to be come back. Welcome back. So I hope that you had a fruitful discussion with your classmate. Okay. So, oops, sorry, this is not the one.
Ya.
Okay.
So,
Okay.
adik-adik semua, tadi seperti yang disampaikan Prof. Nori, nanti Prof. Nori akan tanya satu soal, nomor 1. Nanti cukup satu moderator yang jawab ya. Misalnya grup berapa, grup 5, terus Q-nya, question nomor berapa, terus jawabannya A atau B ya, seperti itu ya. Grup berapa, Q berapa, A atau B gitu ya. Oke, please, Prof. Nori, please you can continue now.
Okay, so so we will start the study session, and you have to report the team result. So only one, as I told you, only one representative student can send the answer through chat. And if the answer is correct, we will move on to the next question after a brief description. But if the answer is different from other group, I will randomly ask group members the reason why how you concluded that answer. Okay. Let's move on to the questions. Question 1: which hormone receptor is mainly located in the cell nucleus? Okay, send the answer to the chat.
Silakan kirim to everyone.
Everyone, representative student per group. So should be only one answer per group.
Yeah.
Okay, use the chat. Okay. Wow. Oh, that's nice. Okay. Okay, you have to share the answer to others, okay? So do not send directly to me. But anyway, all of them, most of them did so. Okay, great. Everybody, all group answered D. Yes, of course. Steroid hormone and thyroid hormone receptor is located in cell nucleus. Among 5 groups, among 5 hormones, only testosterone is steroid hormone. So the receptor is mainly located in the cell nucleus. In other hormones, these are all hydrophilic hormones, and the receptor is located in the membrane. Okay, everything is correct. Okay, move on to the next question. Which hormone is hydrophilic? Okay, answer. Wow. You received the information from the morning class students?
I don't know. Could be.
Wow. Unbelievable. Because, correct rate is much lower in the morning student. Uh-oh. Anyway.
Yes.
Okay, everybody show the same answer. Yes, only oxytocin is hydrophilic. Other cortisol, estradiol, aldosterone are steroid hormones, which are hydrophobic, and the thyroxine is also, it is not the steroid hormone, but it is hydrophilic also. So only oxytocin is hydrophilic. Okay. Question 3. Okay, go ahead, question 3. Uh-oh.
I suspect something.
it is not the right things to do, actually. You know, making a correct answer is not important. You know, doing discussion is more important. Or I should have prepared the different questions. Anyway, okay.
Okay.
Everybody answer the correct answer. Dopamine is an inhibitor. Okay, so I'll ask the. So dopamine suppress which hormone? Okay, you can randomly send me the chat. Dopamine suppress which hormone in anteropituitary? Anyone can send the answer. Okay.
Yes.
Just send through the chat.
Yes. Oh. Oh.
Wow. Wow, great. Okay, thank you. I cannot believe it. Everybody saying the same correct answer. But anyway, okay, so okay. Okay, I'll ask this other question. Also, okay, which hormone is posterior pituitary hormone in question number 3? Which hormone is posterior pituitary hormone? I mean, question 3. Wow, excellent. Okay, great. Thank you.
Okay, stop.
Okay, that's fine. Okay, I'm gonna move on to the question 4. The role of growth hormone is, okay, go ahead. Question 4, just representative student can answer.
Yes.
Wow. Everybody showed the correct answer. So no discussion here.
Discussion here.
Wow.
Oh,
Okay. Anyway, the role of growth hormone is to stimulate IGF-1 secretion, and it does not accelerate insulin action, or it does not inhibit the gluconeogenesis. And okay, growth hormone does not accelerate brain development, but do you know any hormone which accelerate brain development?
Okay.
Could you tell me through chat? Okay. Good. Okay. Well, this study session can finish very early, quickly. Okay, everybody prepared very well.
Yes. I think so. Somebody.
Unbelievable.
We have to suspect.
I should have prepared the different questions. Okay. Question number 5 anyway. Prolactin stimulate. Which one? Okay, question number 5. Go ahead. Question number 5.
Number 5.
Okay.
Yes.
Yes, okay. Okay, milk production. Okay, all group answered. Okay. So milk ejection is stimulated by oxytocin. Milk production is prolactin. Urine reabsorption is by vasopressin. Uterine contraction is also by oxytocin. How about mammary gland development? Do you know any hormones that stimulate mammary gland development? Wow. You guys prepared very well. Yes, estrogen.
I didn't expect it.
Wow.
Okay.
Okay.
Very fast.
Okay, so which clinical symptoms is not seen in acromegaly patient? Go ahead. Question number 6. Okay. Okay, some group answered A. Okay, some group answered A. Okay, group 1 answered A. So Nadila, could you tell me how you make this conclusion?
Okay, Professor.
Yes.
The reason why we answered the A first is because actually I think we thought that it was the condition of insulin deficiency because one of the symptoms of insulin deficiency is thirst. So we answer A.
Okay. You have to think about the action of growth hormone. The action of growth hormone is to antagonize insulin action. So even if there are these excess of growth hormone can become the diabetes mellitus, but the blood glucose level is increased because growth hormone antagonize the insulin action. So high glucose can cause the thirst. I'll let you know the mechanism later. Okay. So, but on the other hand, osteoporosis is not common in acromegaly patients because the role of growth hormone is to make bone osteogenesis. Okay, so C is correct. Okay, 7. Question 7. Go ahead. E E E E E E E E E E E E. Well, okay. All group answered E. Yes, of course. So in the kidney, vasopressin mainly act as collecting duct. So this is true. And in case of aldosterone, it acts both discharge tubule and collecting duct. So the site of action is different among hormones. Okay. Question number 8. Which phenomenon is not seen in islet beta cell after glucose uptake? Okay, go ahead. D. Wow. Most of all, again, all group answered D. Okay, that's true. After glucose uptake, ATP is synthesized by activation of TCA cycle. So the K channel, ATP sensitive K channel is closed by increased amount of ATP. And closure of K channel can induce depolarization of the cell, causing the increase in intracellular calcium level, and insulin secretion is induced. Okay. Question 9. Go ahead. D. Wow. Okay. The action of insulin is to stimulate glucose uptake. That's true. But you have to remember that insulin inhibit appetite. This is also very important. Okay. And the insulin also inhibit lipolysis. Also, this is very important point. Insulin can act not only to the glucose homeostasis, but also they can regulate lipid homeostasis and protein homeostasis. Okay. Okay, question number 10. Go ahead. Question 10. I cannot believe it. You know, this is very, actually, to be honest, this is a very difficult question, and 100% correct is quite strange to me. Okay. Group A again, I think you are doing very good job because, you know, probably you have not heard anything from the previous group. So could you tell me, Group A, Group 1, again, could you tell me why you thought that brain?
Excuse me, Professor, I would like to answer it from the group 1.
Yep.
The main reason from our group we answer A is because we thought that the brain is the most important organ, so insulin action should be more concentrated there.
Yeah. So this is a discussion that I want to talk here, okay? Thinking in such kind of manner is very important. Although this is not 100% correct. Until recently, insulin was not considered as the target organ of insulin. But recent studies have shown that insulin can also act in the brain, particularly in the hypothalamus, to control appetite and energy homeostasis. But the biggest site of action is liver, okay? Because thinking about the anatomy of the pancreas, insulin is secreted into portal vein. So the concentration of insulin is highest in liver compared to adipose tissue and skeletal muscle. Many insulin is consumed at liver going through the portal vessel. Okay, so this is a very important point. Again, actually, correct answer is not important for TBL. So I wanted to have this kind of discussion. Okay, question number 11, go ahead. 11, go ahead. C. Yep. GLUT2, GLUT4 is the main glucose transporter regulated by insulin. But also you have to remember the importance of GLUT2. GLUT2 is expressed in liver and pancreas. And glucose is uptaken through GLUT2 in pancreatic beta cell and also in liver. GLUT4 is not expressed in liver, but glucose is uptaken through GLUT2 in liver. Okay? Okay. Okay, question number 12. B. Okay. Okay. If okay, all group show the correct answer. How about aerobic glycolysis instead anaerobic glycolysis? How many ATPs are produced? Can you answer? Oh,
36.
everybody can. Okay. Okay, 36. Okay, thank you. That's enough. Okay, question 13. Okay, go ahead, question 13. Okay. Okay. Group 2 answered D. Okay, group 2. Serena, okay, go ahead.
Excuse me, Professor.
Yes.
I'm trying to answer why we choose D in number 13.
Yep.
So in our discussion, it's we hardly find the function of glucagon to elevate the plasma of glucose level. So in that reason is why we choose D.
Okay. Great answer. But the glucagon is a major hormone which is responsible to increase glucose level under hypoglycemic condition. So other hormone, so GLP-1 is also produced from the same gene as glucagon, but GLP-1 can stimulate insulin secretion. So this does not elevate, GLP-1 does not elevate plasma glucose levels. Other hormones are all responsible in inducing plasma glucose level. Okay, thank you. Okay, question 14. Okay, go ahead. Okay. Question 14. Okay. Group 1 said B. Okay. Again, someone in the group 1 tell me the reason.
Okay, Professor.
Yep.
So why we answer B in number 14?
Yep.
Is because in our discussion we thought that glucosuria, which is a condition where there is glucose in the urine excreted by the human, is because there is a decrease in glucose reabsorption. So that is why we answer B.
Okay, okay, nice answer. Actually, I would like to give the group A in the best score. No, you guys think very carefully. Although the question is not always correct, but it's very nice answer. But you have to remember there is a 3 major target organ of insulin. One is the liver, 2 is adipose tissue, and 3 is skeletal muscle. So kidney could be also the target tissue of insulin. And there may be some, if the insulin action is decreased in diabetes, glucose reabsorption could be decreased, but this is not the main reason why glucoseuria is induced. This is caused by the excess urine glucose. So if the glucose in urine is much higher than the absorption threshold, glucose can appear in urine. That's why we see the glucose in urine. Okay, question 15. Go ahead. Question C. C, B, 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 E, B, E, B, B. Okay.
Group one different answer.
Yeah, there are several groups show the different answer. Okay, I need to tell you the mechanism causing type 1 diabetes. It's a bit difficult question because, probably you have get some information from their morning class student, but in the morning class, many students answer that the E may be the correct answer. Genetic defect of eyelid development, but this is not true. Okay. Type 1 diabetes is not caused by genetic defect. Type 1 diabetes is caused by autoimmune mechanism. That means if virus is infected, which can infiltrate into the pancreatic beta cell, so your immune cell can recognize infected beta cell as an enemy. So your immune cells, like a lymphocyte, can attack the beta cell. So beta cell will be lost by autoimmune mechanism. So B is correct. But in case of type 2 diabetes, C could be also correct because in type 2 diabetes, beta cell function could be also decreased. So I expected either B or C or E, and some group answered C or E, which is also fine, because some people may believe so. So I won't be surprised. Okay.
Noni.
Yes.
Do you have any case that after COVID-19, is there any increase in case of the diabetic because
Yes.
of? Do we have any recognition?
Yes. Actually the number of diabetic patients is increased because everybody has to stay home. Right?
Not really.
So the reason is different,
Different, okay.
Yeah, because I have not heard that the COVID-19 can cause the type 1 diabetes. Okay. But I have heard that the COVID-19 can cause Kawasaki disease in the child. So Kawasaki disease could be also considered as the autoimmune disease, although the cause is not fully understood. But I have heard that Kawasaki disease patient has increased. Okay.
Okay, thank you.
Okay, I'm gonna send clinical case through chat. Sorry, student, the case is different from morning session this time. So you cannot refer previous previous students and notes. Okay, so please download case 2. Okay. Okay. Clinical case 2, acromegaly, growth hormone secreting tumor. Okay, this is case presentation. A 41-year-old woman who has worked at the local department store. Her friend noted that her physical appearance had changed. Her feature had become coarse. So it's really, there are a lot of bone is getting bigger. Her lower jaw was protruding, and her teeth had separated. They were concerned that she might have a health problem, and one of the colleagues volunteered to ask her. Then she expressed concern of her own. She disclosed that her menstrual period had suddenly stopped by 5 years ago. Her hat, shoe, and glove size had increased, and that her finger had enlarged so much that her rings no longer fit. Every night she had been getting up several times to urinate. After the conversation, she decided to see the physician for evaluation. Physical examination revealed a woman with coarse facial features, a prominent jaw, and large hands and feet. Okay, this is physical examination laboratory result. So the fasting plasma glucose level is 250 milligram. Fasting growth hormone level is 90. IGF-1 is elevated. FSA decreased. Prolactin elevated. Urinary glucose increased. So magnetic resonance imaging of her brain showed a large intracellular mass that was pushing upward on the roof of the sella turcica. The physician diagnosed her with acromegaly caused by a pituitary adenoma that was secreting both growth hormone and prolactin. Okay, this is in many acromegaly cases, not only growth hormone, but also prolactin is secreted. Okay. Okay, group discussion. I have 6 questions. A significant feature of acromegaly is widening of bones in the skull, hands, and feet. What is responsible for this widening? And she did not exhibit increased body height, so that height was not taller. Why not? Okay, so what explanation can you provide for the increased fasting blood glucose level? Why did she have glucose in his urine? Why did she have increased urination? What was responsible for amenorrhea? Okay, so I will give you 15 minutes. So breakout session will start now, and you have to give the answer after that during the next study session. Okay, 15 minutes.
Okay. Yes, the breakout room is already open.
Okay.
You can join to go to breakout room. 50 minutes, remember.
Okay. 50 minutes. Okay, so 340, right?
Okay, yes.
340. Oops.
Dokter Wardi masih aktif?
Masih, Dr. Budi.
Ya, lanjut, Prof.
Masih aktif saya, masih mendengarkan.
Iya, Prof. Kami ke grup masing-masing dulu, Prof. Boleh, Prof, masuk ke grup masing-masing saya.
Mana caranya?
Oh, ada di pilihan breakout room.
Breakout
Prof.
room.
Iya. Ini mahasiswa diskusi di breakout room masing-masing. Ada pilihan 1, 2. Kalau dari HP ada di kiri atas, Prof.
Oh, breakout room itu ya?
Ya, diklik nanti ada
Iya.
grup 1 sampai ya, Prof. Bisa ikuti dimanapun, Prof.
Oh, itu ya?
Iya, karena ini nunggu 50 menit diskusi di ruang masing-masing, Prof.
Lama itu emang.
Iya, kami ke grup masing-masing dulu, Prof.
Prof. Irfan.
Yes, Prof. Nori?
Yes, I just showed through my chat that
Yes?
I have noticed that many students is just making a copy and paste of the some
Oh,
website through the internet.
okay.
Some does not. So many group, the
Yeah.
discussion is not so active. You know,
Okay.
this cannot be happen if you have a TBL in the classroom, but because we have a this
Yes,
session
of
through
course.
the web, so they have a time to check their website,
Yeah,
right?
okay.
So, but
So I have to make sure, I have to remind them for this one.
so the
Yeah.
discussion is much more important. Of course, they can search the web by themselves, but just making a copy and paste through the web is not what I wanted them to do. They have to use their own words, right? Yeah.
Yeah. So I will talk to the faculty. So that's why the faculty members have to remind them.
Yeah, what I want to have them to have is a discussion,
Yes.
not just a making copy and paste.
Yes, of course. Everybody, so sorry, there is some IT-nya ya, some mistake. So you can join again to your room. Something mistake from the IT. Please join again to your room. The time is still 15 minutes. Please rejoin again to your room. Hello, Prof. Nori.
Yeah, discussion has become a little bit active.
Yes, yes. Yeah, but actually, yes, indeed, that the afternoon class is actually not too smart compared to morning class, because we have two kind of selection. Selection, yeah. For the morning class is mostly come from national selection. So smart student mostly in the morning class. So that's why discussion is very, they have more time to discussion or something like that.
Yeah, I noticed that in the morning class, the discussion was very active.
Yes.
And yeah, they did not copy and paste. Of course, they did some, but they tried to share their ideas together. So the discussion was more active, but the afternoon class not so active compared to the morning ones. And also, they try to find out the answer of the questions.
Yes, because the afternoon class is mostly come from local. And yeah, so which means that this is our problem also, that our the obligation of the university that we have to receive a local student to make a special class.
Okay.
So the selection is not too competitive compared to the morning class.
I see. We'll see what kind of answer they will give. Right?
Yes, I know that. Yeah.
But I liked the people student in the group 1, for example.
Yes. For group 1 is very active. I see.
They're very active. That they try to think about their own brains instead of finding something from the web. So I like. So you can give them a good score.
Yes.
Yeah, I like the answer of the group 1. Yeah.
And they try to be different with their own reason. And like you said, like we saw on the discussion that they gave the different answer, so they didn't trust to their friends, morning friends. Their own answer.
That's wonderful.
Yes.
Nice. Yeah. Okay, we have 10 more minutes.
Yes, 10 more minutes. So do you receive the email from Professor Prof?
Yeah.
Professor Prof opened the opportunity to join the symposium.
Yeah, I already sent the email to the Professor Adrianta.
Yes.
Because we have some experience in doing practicals on the web. Some of which I already showed you before.
Yes.
I have other practical courses on the web. Unfortunately, we give the student a question paper. So we are now correcting the question paper, and actually we are planning to write some article and submit to the Advanced in Physiology Education. So, and I also be concerned with D about that. Yeah.
Oh yeah, of course. So my question to you that how about this final score for the module? Do you give them A score, a B score, a C score, something like that?
Yeah.
A score, B score, okay.
Yeah, because I asked students to write a report based on the web-based experiment. And I give them the raw data generated by a volunteer student. And they have to write a report about the mechanism or reason or experiment procedure is correct or not or something like that. So they can write a long report. So based on that report, we can make the score for them.
Yeah. So which means that your university also use the GPA?
Yeah, of course.
The final.
Yeah.
Okay.
Yeah.
how did you still use the norms reference or standard reference for the score?
Well, we just evaluate based on the scores. So the distribution of the score is not standardized.
Okay, okay.
So like sometimes they prefer giving this like a 10% A or 20% B or something like that, but we don't do that. Yeah.
Okay. Oh, yeah. So which means that it can be that in one module that maybe 100% got A score. It could be like
Sometimes
that.
yes, sometimes yes, but usually many students got a B or C.
Okay.
We seldom give them A, and only one or two students got S.
Yeah. because we have we have like a hot issue right now, because our president of university rector, he connected the final score of the student to the performance index of the lecture. So if one model that if the student got maybe only 10% of the student get A score, so the performance index of the lecture is worse.
Right. Yeah, sometimes sometimes student and teacher they evaluated something like that.
And it's become hot issue because the performance index is directly to the end year's bonus.
Oh.
So if the lecture got worse score, so the president will not give him or her extra bonus for
really
for the end of the years.
Well, our bonus is based on the evaluation score by student.
Yes.
So student can evaluate. It does not based on the grading, but the student can evaluate teachers by by answering the question paper. If some students, if some teacher got a very bad score from the student, bonus maybe a lot lower, but
So
it does not. Yeah, it is not based on the grading of the.
So that's why I, as a vice dean, that still find to the a good formula, because so many medical lecture basically cannot receive that.
Right.
Say that it is impossible if I got the A score because I want to get a bonus. So we are trying to find a formula how to connect the expectation of the president and for the reality. So I talked to Rob that he said that maybe we have to make a stronger of the formative assessment, something like that. We are trying to find the formula for that.
Right. Yeah, it's difficult. Similar problem is also going on in Gunma University. So the student score in the medical school is much lower than other faculty. Because, for example, in the physiology class, it is very, very difficult to get the 80% correct answer in the exam, right? Many people only get 60 or 70 or something like that. But if you go to other faculties, such as education, or like a manufacturer, the score is much higher. So when you submit the scholarship to the university, the acceptance rate is much lower for medical school student, although their high school grade is much higher than other faculties.
Yes. So for this year, so that so many lecturers are angry to us.
Right.
They didn't get a bonus for the 2020.
So as you mentioned, probably a system to assess teachers should be altered.
Yes.
Not be based on the student grade.
Yes.
Should you have to ask students, if he is a good teacher or not, but if he's a good teacher or not, right?
Yes.
Because let's say, like, if you even in the medical faculty, if you compare the education between like a physiology and the otolaryngology, the content in physiology is much more than otolaryngology, right?
Yes.
So the student grade should be much lower than otolaryngology, for example, right?
Yes,
You
of
agree?
course. So that's why we have to find, for the example like this, that we ask you to teach us, to say, to give the insightful moment for the students. So our goal is to increase the motivation the student to love physiology. That learning physiology is very wonderful.
Yeah. Okay, we have one. Okay, yeah, time is coming. Yeah. Okay.
Okay, one more minute.
Yep.
Okay. Do you have any news from Rob that where is the city that will be organized for IUPS education?
Yes, I received it. Tianjin.
Tianjin. Okay,
Tianjin.
Tianjin.
Yes.
For 1 hour from Beijing, yeah.
I believe so. Yes.
Tianjin.
Yes. You know, recently I became the president of FAUP's teaching commission, education commission.
Okay.
So I'm trying to collaborate with Rob how to construct the IOPS teaching workshop.
Okay.
Yeah.
So I did not realize where is the POPs Congress next after Japan?
Actually, it was scheduled to be in Tehran.
Tehran.
But, they have some financial problems.
Oh.
And also safety issue.
Yes.
So they changed the FAUPs from Tehran to Busan, Korea. Not Korea. So
Daegu.
Daegu, and it will be held in 2023. So
2023.
next year of IUPS.
Okay. Time is up. We close the room.
Okay.
Okay, everybody, time is up. So you are connecting again to the main rooms. Maybe Prof. Nori will give you some advice before we start the discussion. Short advice that the most important is you got the knowledge, not the right or wrong. Is it true, Prof. Nori?
Yep.
Okay, please, Prof. Nori, please continue.
Okay. So so we have this clinical case, and we have a group discussion from now on. So I will randomly ask questions to one representative student of each group. So so you can answer my question, okay? But and also, where's my chat? Here we go. My screen is gone. I don't know why.
Oh.
Okay, here we go. Oops. Okay, group discussion. So we will start the study session. 1, a significant feature of acromegaly is widening of bones in the skull, hands and feet. What is responsible for this widening? Okay, I will find out. I close my eye and find out one name. Try to put one name from the sheet. Okay, group 14. Anissa,
kelompok 14.
Anissa, group 14. Please answer question 1. Okay.
Anissa Rahmawati.
Are you here?
Hello, Anissa. Hello, Anissa.
No.
I don't know what happened to Anissa. Is it connection?
Disconnected.
Profesor.
Okay,
Okay.
please. Yes.
Mohon maaf, Prof. Ini boleh jawab pakai bahasa Indonesia.
Try to English. Answer it in English, yeah? Okay, it is okay for if you have make a mistake. No problem.
Yeah, no problem. You know, my mother tongue is not English either. So try to
Okay.
speak in English.
Slowly, if you cannot speak fluently and fast, please speak slowly.
Yep.
Hello, Anissa.
Sama pribadi, Ban.
So anyone, yeah, anyone in the group 14 can help her.
Okay. Ya, yang lain boleh. Another one.
In group
Another one,
14.
silakan.
Okay.
Please help Anissa.
Rapli, please, Rapli, answer. Number one.
Rapli, boleh.
Rapli, silakan Rapli. Rapli.
Okay.
Yeah. Okay, unmute Rapli.
Disconnected?
No.
Yeah.
Okay.
Okay.
It's okay, Prof. Rapli,
Okay.
please.
Unmute aja.
Okay, the answer is when hypersecretion occurs after adolescence, when epiphyseal plate has closed, the body can no longer gain height.
Number one. Rapli,
Yes.
number one.
Yes.
Yeah,
Yes,
go ahead.
Okay, go ahead.
However, under the influence of excess GH, the bones become thicker and the soft tissues, especially connective tissue and skin, itu proliferate. The unbalanced growth pattern can give rise to defect known as acromegaly. Acro means limbs and megaly means large. The most noticeable thickening of the bones is in the extremities and face. The face continues growth through, almost resembling an ape, because the jaw and cheekbones become protruding due to the thickening of the facial bones and skins. The hands and feet are enlarged, and the finger and toes are very tightened. That is the answer. Sorry for my language, Prof.
Okay, that's fine. Right, I understood. I understood perfectly. Don't worry about that. Okay, so growth hormone can induce the size of bone, right? However, how growth hormone can make the bone thick? So now I'll ask the other group. Okay, group 5. Robbie, Lafri, yep. Could you tell me what is the mechanism of growth hormone action to increase the bone size?
As I know, and the discussions was discussed before.
Yes.
I only get information that when the epiphysis has closed, when we have puberty, and growth hormone is in all control of this widening.
How? You know, epiphysis, growth of epiphysis, and growth widening of the bone has different mechanism of growth hormone action. The target is different. Okay, I cannot see my what's going on. Let me close. Yeah. Just a second. Okay. Okay, got a chat. Okay, epiphysis and epiphytic growth and bone thickening have different target. So in case of bone widening, what is the target? Which cell is the target of growth hormone? Everybody can write. Everybody can send me the answer through the chat.
Okay, chat please.
Chat please.
Target growth hormone pada tulang.
Don't write in Indonesian. I cannot read it.
Ayo, siapa yang bisa? Sel targetnya apa? Organ targetnya? No one?
Whoop. Got it. Don't please share.
Okay.
No, some send me the correct answer, but unfortunately he sent directly to me.
Yeah.
Okay, please send.
To everyone.
Everyone, please send. Osteoblast. Osteocyte. Two answer appeared. Osteocyte and osteoblast. Anyone else? Very few answered. Only 1, 2, 3, 4 answered. Chondrocyte. Okay, osteoblast and chondrocyte. Okay, good. Good, nice try. Please try to share your ideas with others. Don't send directly to me. Yeah, okay. All right. I got several answers from several students. Okay, 3 answers. We have 3 answers. Osteocyte, osteoblast, and chondrocyte. Okay, usually around the bone during after growth, chondrocyte does not exist so much. So osteoblast can be transformed to osteocyte by stimulation of growth hormone. Okay, so osteoblast can produce bone, making bone thick. Okay, so question 1, this widening is induced by bone formation by stimulating differentiation of osteoblast. The body can no longer gain height, however, and nevertheless growth hormone. Okay, someone sent me a very long answer, but you have to share this answer with with other students. Okay, so as I told you, in this case, bone widening is induced by the differentiation of osteoblast rather than increase in chondrocyte. Okay, and also soft tissue is also proliferated by growth hormone or IGF-1. Okay, So question 2, she did not exhibit increase in body height. And someone already told me that because epiphyseal plate has been closed. So what is the mechanism to induce increased body height at epiphyseal plate? So tell me the mechanism of growth hormone on epiphyseal plate. Okay, group 18.
18 ya.
Vera, group 18, Vera. Could you tell me the mechanism action of growth hormone at growth plate?
Epiphysis ya.
Yeah.
Vera. Vera Tenzi.
Or someone else in the group 18 can help her?
Ada yang bisa? Grup 18, bagaimana mekanisme growth hormone terhadap terhadap epiphyseal plate?
No one can answer? You cannot get a point.
Ya, grup 18 tanpa poin nanti.
You have to say something.
Ya. Ayo. Bagaimana growth hormone bisa berpengaruh pada epiphyseal tuh dia di mana gitu? Kenapa bisa nutup? Ayo, grup 18. Yes.
Can I try to answer the question?
Okay,
Yes,
Vera.
go
Yeah,
ahead.
sip. Good one.
So the growth hormone can stimulate the cell in the epiphysis plate to
Good.
mitosis. So there is increase of body height, but after the puberty,
Yes.
the epiphysis plate is already closed, so the growth is horizontal, not linear.
Good. Nice answer. Great answer. This is what I wanted to hear. You did very good job. Okay, she said that proliferation of some cell could be stimulated at the epiphyseal plate. Proliferation of which cell is accelerated by growth hormone? Okay, I'm going to move on to the next group. Group 7, Fatima. Fatma.
Yes.
Okay. Proliferation of which cell is stimulated by growth hormone? In the chat, I found several answers. Or anyone else in the group 7 can ask?
Fatma Zahra bisa?
Increase the osteoblast to proliferations.
Osteoblast is not the main player at the growth plate. Proliferation is this is not the main player. Growth hormone stimulate proliferation of other type of cell. Okay, which one? Okay, yeah, go ahead.
Chondrocyte.
Yeah, chondrocyte. Exactly, that's true. So, actually, growth hormone has two actions. One is chondrocyte proliferation. So, chondrocyte is proliferated at the epiphyseal plate, which is stimulated by growth hormone. Then with the growth of epiphyseal plate, chondrocyte is replaced by osteoblast, with which ossification starts. Okay, so this is a kind of, it's very similar to intrachondrial ossification. Everybody knows intrachondrial ossification. This is induced during development, but epiphyseal plate, similar phenomenon is seen. So on the other hand, in the adult bone, many osteoblasts are located just next to the bone, which can differentiate into chondrocyte, osteocyte, or osteoblast itself can increase the calcification of the bone. So new bone is formed, so bone become wider with osteoblast, with peripheral osteoblast. Okay, and important thing is growth hormone not only stimulate directly to the chondrocyte, the osteoblast, but also growth hormone can act at the liver and produce IGF-1, which can also stimulate osteoblast and chondrocyte to grow. Okay, so please note that even if growth hormone present without IGF-1, this kind of growth cannot be fully induced. So it is not growth hormone, but IGF-1 may play some major role in increasing body height and bone widening, okay, rather than growth hormone itself. Okay. So this is action of growth. So this is a basic action of growth hormone. Okay, question 3. What explanation can you provide for the increased fasting blood glucose level? Okay, I'm gonna move on to the other group. Group 10. Okay, ARDA 3. Group 10. Group 10, ARDA 3. Group 10, can you hear me?
Yes, Prof.
Okay, tell me the reason.
I will try to answer the question.
Yep.
From our decision, the answer is growth hormone is antagonist to insulin action. The increase of growth hormone will disrupt the action of insulin so that the glucose uptake from blood will be also decreased. Growth hormone cause multiple effects that influence carbohydrate metabolism, including decreased glucose uptake in tissues such as skeletal muscle and fat, and increased glucose production by the liver. Insulin's action is to stimulate uptake and utilization of glucose in skeletal muscle and adipose tissue, and to inhibit gluconeogenesis by the liver. This leads to increased blood glucose and concentration. Thank you, Prof.
Wow, perfect. Congratulations. You answered the most perfect, almost perfectly. Yes, that's true. Growth hormone antagonize the action of insulin, particularly in the liver, and it inhibits glucose uptake also in the skeletal muscle, and it can increase gluconeogenesis. So here, so it's a growth hormone can produce glucose from lactic acid to glucose. So you can check out the red line here. So this gluconeogenesis is activated by growth hormone. I'll give you this table later. Okay, don't worry. You can take a look right now. Okay. So on the other hand, okay, probably you have already heard from the morning class about action of insulin. So what is the action of insulin? Maybe I can ask you some additional question. There are several actions of insulin. By taking a look at this figure, you can answer me which cycle is activated by insulin in particular. Group 12, Devina, Group 12, Devina, Fural, yes. Okay, could you tell me the action of insulin here? Okay. According to this map, which part is activated by insulin? Yes. Hello? Can you hear me? One particular part is strongly activated by insulin. Which part do you think? Or anyone in this group can answer this question?
Excuse me, Professor, can I try to answer this question?
Okay. Could you name me?
I'm Devina.
Okay.
I think it's the gluconeogenesis.
Yep. Yes, you mean synthesis of glycogen, right? Okay, yes, this is insulin activate glucose uptake and glycogen synthesis. So this green part is strongly activated by insulin. Okay, that's correct. All right. Okay. So we come to know that the increased fasting glucose level by the increase of growth hormone. Okay, so why did she have glucose in his urine, which is called glucoseuria? Okay, this group 16, Risa. Risa, can you
Yes,
hear me?
Prof.
Okay, answer
Um,
me.
Yeah, I want to try to answer the fourth question, including
Okay.
of our group. Why does she have glucose in his urine?
Yes.
Because his growth hormone can increase blood sugar level, so that if the glucose level pass the threshold, it can be reabsorbed so that there is glucose that is not reabsorbed and cause in glucose in the urine. There is glucose is not reabsorbed and then make there is glucose on his urine. It's because she have high growth hormone that increase blood sugar level in his body in her body, Prof. I'm so sorry, Prof.
Okay, wonderful. Yes. So the glucose. So in glomerulus, glucose can be freely filtrated. So with the increase in blood sugar level, glucose in the glucose in the filtrated urine is also increased. But in most cases, glucose is reabsorbed in the, okay, I'll ask questions because some of you got some information for the morning class, so I will ask you a different question. So how glucose is reabsorbed? Do you know the molecule which is responsible to reabsorption of glucose in proximal tubule? Anyone? Okay, chat, send through chat. Anyone knows the molecule responsible glucose reabsorption? Actually, currently, this becomes a very important drug for treatment of diabetes. Anybody knows about the mechanism of glucose uptake in proximal tubule? No one? Please send me chat. Insulin, yes, but insulin, the target kidney is not the target organ. Well, there may be some insulin receptor in kidney, but reabsorption of glucose is not by the stimulation of insulin. Something else is required to reabsorption of insulin. Whoop, other, very close, very close. GLUT4, okay, very close. Wow, 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 yes. Yep, yep, yep. Okay, 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 yes, thank you. Okay, so SGLT, particularly, okay, SGLT2 is particularly important for reabsorption of glucose. So do you know the difference between GLUT and SGLT? Do you know the difference between GLUT and SGLT? Do you know the difference between two molecules? Can you answer me through the chat? No one? No answer to tell me, okay. GLUT2 is transporter, SGLT is absorbent. Nice try. Okay. GLUT only transport the glucose, GLT transport the glucose and sodium. Okay, that's correct, but not 100% correct. Yes, okay, GLUT is transporter, S-GLUT is co-transporter. Okay, that's true, but there is a big difference. Not only just GLT is co-transporter. Yes, GLUT transporter only for glucose, SGLT for co-transport glucose sodium, but also there is some big difference. Glucose facilities, it's good to use. Oh, wonderful. Who is that? Melissa. Okay. This is very important idea that you all of you have to share. Okay. Melissa answered. Okay. So okay, you can stop right now. Thank you very much. So SGLT is transport glucose with secondary active transport. Okay, so SGLT require ATP. Okay, NAK ATPase is required for transport of glucose in case of SGLT. However, in case of GLUT, this is facilitated transport, so you don't have to have energy, but the more amount of glucose can be absorbed through SGLT rather than GULT. Okay, because SGLT actively transport glucose. Okay, wonderful. Okay, so this is fasting blood glucose. Why did she have increased urination? This. Okay, so I'm gonna move on to the different group. Okay, group 8. Elizabeth. Group 8. Okay, go ahead.
I'll answer the question that why did she have increased urination is a polyuria was due to osmotic diuresis secondary to her high blood glucose concentration. So the high blood glucose led to an increased filtered load of glucose, which exceeded the reabsorptive capacity in the proximal tubule. I think that's all from group 8, Professor.
Yes,
Thank you.
okay. Okay, so the osmotic pressure of the filtered glucose, filtered urine is increased, right? So even if some part of glucose is uptaken, the osmolality, actually not osmotic pressure, to make things correct, osmolality of the filtered urine is still higher. So to reabsorb water, you have to have osmotic gradient. So through the osmotic gradient, water is reabsorbed from collecting duct to the interstitial place. But if the glucose level is very high, then water cannot be reabsorbed. By the way, which hormone is most responsible for water reabsorption at the collecting duct? Which hormone is? Okay, right. Vasopressin. Okay. Another question. Thank you. Yes, vasopressin is responsible for the reuptake of the water at the collecting duct. So, how vasopressin is stimulated? How vasopressin secretion is stimulated? Can you tell me through the chat? Any other? Decrease blood flow. Any other? Actually, yes. Sometimes vasopressin can be stimulated by a decreased blood flow, but in case of acromegaly, in many cases, blood level is actually blood amount is increased in many cases. So this is not the case for acromegaly. Decrease blood flow. Oh. Okay. I got several correct answer. Yes. Osmolarity is the main regulator to stimulate vasopressin. So increased osmolarity can stimulate vasopressin secretion. Okay, but in this case, I don't know if vasopressin plays some role in increased urination. Okay. Okay, final question, final answer, a final question. What was responsible for her amenorrhea? Okay. Still, I haven't asked this question to many groups. Okay, group 15. Fasan Jordan.
Yes, Professor.
Okay, tell me about the questions, answer of question 6.
I will answer based on my group discussion, Professor.
Yes,
okay.
please.
The increasing level of growth hormone in acromegaly may be caused by anterior pituitary tumor or adenoma. So, in addition of abnormal increasing growth hormone, this tumor may cause abnormal increasing other hormones. For example, prolactin, which secreted in anterior pituitary. The increasing level of prolactin may influence the cycle of menstruation. It may be inhibit the menstruation, then it's possible to stop the menstruation. I think that's...
Okay, so you said the prolactin inhibit the menstruation? Is that your answer?
Yes, it's based on my group discussion.
Okay, prolactin, yes. So actually, oops, sorry. Yes, prolactin level is elevated, right? So how prolactin inhibit menstruation? Okay, group 3.
Group 3.
Group 3. Kofifa. I'm correcting my pronunciation correct? Kofifa Wada. Okay.
Kofifa, yes, right.
Kofifa, do you know how prolactin inhibit menstruation? Actually, this is very important. You know, this is the reason why second baby is mother become pregnant during lactation period. So this is very important idea to know. Actually, there is a hint in this slide. Okay, there's a hint in this slide. Or someone in the group 3 can answer this question. There's a big hint in this slide.
Ayo jawab. Ada tuh petunjuknya di situ. Yuk, terkait dengan feedback.
May I try to answer?
Okay, yes.
I think it's it goes inhibit the FSH and MH.
Yes, that's right. So you can see that FSH level decreased in this patient. So it is quite easy to guess that elevated prolactin can inhibit FSH secretion. But probably you may not know the site of prolactin action. The prolactin inhibits secretion of GnRH in the hypothalamus. Okay, the decrease in GnRH secretion can decrease FSH secretion. Then menstrual cycle is stopped. Not only FSH, but also LH secretion is also suppressed by the decrease in GnRH secretion. So ovulation cannot be happened. So because of that reason, during lactation, mother become not pregnant. Mother cannot be pregnant at the first, at least first 2-3 months. So breastfeeding can inhibit pregnancy. Okay, everybody understand what I'm talking about? Okay. So in this case, as I told you, not only growth hormone, but also prolactin is secreted. Okay? And these two hormones can cause several abnormal findings. One is growth of bone, the other is stop of menstrual cycle. These are caused by the increase in prolactin and growth hormone secretion. Okay? So I will upload additional information to chat. Just a second. Where is the address? Okay. So I have uploaded these 3 slides to you, so you can self-study using these slides. Okay, so we still have 5 minutes. So do you have any additional question?
Okay.
Do you have any other question or comment about TBL? So probably you have noted the difference between PBL and TBL. In case of TBL, objective is the same among all groups. Okay, so the main aim of TBL is to summarize your knowledge and apply to solve clinical cases. So making copy and paste from the web is not desirable. Okay, important thing is to discuss among your friends to find out a solution. This is what I expected. That's why I asked Prof. Irfan not to make a copy and paste during the discussion session. Okay. Oh, someone. So do you have any question, comment? Okay.
Nadira, yeah. Nadira raised her hand. Okay, Nadira, please.
Okay, excuse me, Professor. I want to ask something about the case. It was clearly written that there is some kind of tumor, I guess, in the case. And I want to ask, what does this tumor relates to our case? Does it doesn't relate at all with the case of the person?
Okay, that tumor secretes growth hormone. Okay, in many cases, anterior pituitary tumor can produce growth hormone, which cause acromegaly. So tumor is a source of growth hormone. And in this case, sometimes tumor press the anterior pituitary, inhibiting other hormones to secrete. But in this case, I do not know. From this information, we still don't know whether other hormone is inhibited or not by the large tumor. Okay, but the tumor is a source of growth hormone and prolactin. Okay, is this what you wanted to ask me?
Yeah.
Yes, Professor. Thank you for the answer.
Okay. Any questions?
Any question and comment about the TBL session, please give your comment about the TBL. What is the which one is better for you, the TBL or PBL? Maybe someone can answer this question.
May I answer? May I give my opinion?
Robbie, okay, please.
Okay.
In my point of view, it's such a different mechanism of learning, because meanwhile, when we try to study with PBL, it will give us more time to study by ourselves. Meanwhile, if in these conditions in TBL, I think it's such a great a great in hurry, because we need to think rapidly and think critically in the questions, and some questions maybe we have our question our answers based on our opinions, but sometimes another answer may be better and we cannot find it. I think it's all. Thank you.
Okay, yes, that's true. You need not spend too long time for TBL session. You know, if the short clinical cases, you can just spend 1 hour or 2 hours. So so you need not study by yourself for a long time, but you have to have a knowledge before TBL. That's why I gave the question before TBL. Okay, any other question or comment?
Ya, silakan adik-adik.
Okay, no question, comment?
We have one chat. What is that?
Another one.
Oh, no, from you. Okay, I'm sorry.
Okay.
This is from knowledge.
Sorry. Some people is raising their hand.
Okay, Ahmad Reynal and Octavian Joshua. Okay. Start with Ahmad Reynal.
Okay.
And then continue to Octavian.
Okay.
Please.
Go ahead.
Okay, thank you, Professor, for the chance. I want to ask about the case. In this case, it happened that the patient has got acromegaly, and maybe there's a tumor that caused the acromegaly. I want to ask about how is this a treatment for the acromegaly and of this case, and it can heal the acromegaly of that. Okay, thank you, Professor.
Oh, sorry. I don't understand very well, but in many cases in acromegaly patient have a tumor in pituitary. Some tumor is very big, some tumor is not very big, but regardless of the size of tumor, even if it's small, some patients suffered greatly the acromegaly because high growth hormone level. So in many cases, growth hormone can be produced in tumor. Is this what I want to ask you? You want me to ask?
Yes, Professor.
Okay, thank you.
Okay. Thank you, Professor.
Yeah, okay.
Yeah, Octavian, please. Octavian, yeah.
Oh, okay. Thank you, Professor. Thank you, Doctor, for the chance. I want to ask about the fact about growth hormone antagonize the insulin actions. So based on my logic, growth hormone stimulates the cell growth. So for the cell to grow, it will need ATP or energy. And we all know that the insulin, it promotes the uptake of glucose from the blood to the cells, so it can initiate the TCA or Krebs cycle to produce the energy. So why does the growth hormone antagonize if it needs to have energy, and insulin provides energy for the growth hormones to work efficiently? Thank you.
That's good question. Okay, wonderful. There must be some balance between growth hormone and insulin. Okay, when blood sugar level become too high, blood sugar become toxic, so you need insulin, right? But if the blood sugar level become very low, you have to have blood sugar to increase, right? To send the sugar to brain. So the role of insulin and growth hormone is not always the same. Okay, there must be timing of action. Okay, other important thing is both insulin and growth hormone can also activate protein synthesis. Okay, so growth hormone can make the muscle to grow. Insulin can also make the muscle to grow. So sometimes insulin growth hormone can antagonize with insulin, but this is not completely the case. Okay, it really depends on the situation. Okay. Okay. Any other questions? Comment?
Hello, Prof. Nori.
Yeah. Oh, hi,
Oh,
Prof.
hello,
Adrianta.
Dr. Adrianta. Okay.
Nice,
Dr. Adrianta want to give a comment?
Yep.
Yes, nice session today. I enjoyed it very much. I'd like to ask you, is your team-based learning
Yep.
Throughout the whole curriculum? I know the curriculum in your school is 4 or 5 years.
Yeah.
It's all with team-based learning.
Well, yes, we used to have PBL, but recently we have completely transformed from PBL to TBL because PBL requires so many teachers to get involved. But in case of TBL, only, like even one tutor can deal with like 100 students. So recently we transformed completely from PBL to TBL. We only have, well, 1 or 2 PBL sessions upon entry of the university. So right now we have only 1 PBL. Others are all TBL. Okay, this is my answer. Yep.
Then I like to know, when more team-based learning is given at your school, what about the lectures? Are they reduced also, or they have the same lecture hours?
Yeah.
Before.
Oh yes, absolutely. Because students have to self-study before TBL, and in addition to lecture, I usually give them the range to study before TBL. So students have to self-study by themselves and answer the question. I write, and then discuss with students which increase their memory. So actually, before and after TBL started, if you compare the student score, actually after starting the TBL, the grade of students became better compared to the previous years before TBL started. This is my answer.
So I mean, you give the same lecture hours as before. You don't have team-based learning.
No,
You don't
actually,
reduce lectures.
yes, I did reduce the number of lecture after
Yes.
TBL is included.
Yes, yes.
Yeah.
You have to do that, I think.
Yes.
Yes, yes.
You know,
Okay.
yeah, even without lecture, student memory can be increased. You know, and the student can deal with questions by utilizing their memory. So I prefer a TBL rather than regular lecture. Yeah.
Yes. One more question. You
Yes.
give questions before the team-based. Is that the same questions as during the IRET? During when they come?
Yeah.
Is it the same questions or different questions?
No, different question.
Different, yeah. Okay.
Yeah, during IRAT, I give them very easy questions.
Yeah.
Just recognize whether they studied or not.
Yeah.
Yeah, but for during the case presentation, of course, I give the more difficult question to solve.
Yeah. So I think, yes, team-based learning is good when you don't have too many tutors. And when the class is like 300 and so, it's difficult.
Yeah.
But for smaller schools in Indonesia, when the new medical schools has only 50 students, I prefer problem-based learning still.
Yeah, well, the object
It's depend, I think.
The objective is different, you know, TB and PBL.
Yes.
Yeah.
It's depend.
Yeah. Anyway, okay.
I think
Thank you.
it's
Yeah. Thank you very much for your comment. Anyway.
Okay. Thank
Okay.
you.
Okay. So.
Okay, Prof. Nari, maybe we have to continue to our next session.
Okay.
For this evening with Bias, for giving the assessment for doctoral candidate for Bias. So I sent to you the Zoom link for this afternoon.
Okay.
In private.
Okay.
So maybe we still have 15 minutes for break.
Yep.
For a while.
Yep.
And then 5 o'clock we will continue with the session.
Okay, we have 15 to 20 minutes for break.
Yeah.
Okay, I can have time to drink tea. I have a problem in my throat.
Okay, thank you very much.
I kept talking for 6 hours.
So
anyway, okay, thank you very much.
Okay, Prof. Nori, on behalf of our faculty, on behalf of the Dean, actually our Dean observes our activity today, and he gave say hello for you and gratitude and thank you. But in this afternoon, he has to go to see the president of the university because some meetings that they have to do. So we would like to say thank you for you.
Okay, my pleasure.
And we have that maybe we can meet again. I hope so. In 2000 next year, we must meet again in Beijing. And like you said that 2023 in Daeju, Korea. Okay. But
also,
before that, you have to come here, and I will come to you.
Okay. Okay. Thank you very much.
Thank you very much.
Okay.
Please give applause for Prof. Nori. Ya, ucapkan
Thank
terima kasih
you.
sama-sama ya semuanya. Please unmute. Terima kasih.
Yeah. Sure.
Yeah.
Nadira, kenapa? Okay,
I'm sorry if I interrupt you, but for the last link, there are something that I want to say to Professor Nori before we end this session.
Okay.
Yeah, go ahead.
But 日本語で言ってみてもいいですか?
Wow, you speak Japanese. 日本語でいいですよ。
まずはお忙しい時に私たちのスリウジャヤユニバーシティに来ていただきありがとうございました。そして短い間に 内分泌系についてたくさん知識を教えてくださって本当にありがとうございました。お会いできて光栄です。またまたのお越しをお待ちしております。
Wow. How did you learn Japanese? You stayed Japan before?
はい、今までまだ勉強中です。
Have you been to Japan?
1回だけです。
Wow. But excellent. Amazing. すごい。
You must translate it because we do not understand.
Oh, yeah, she just really thank you very much. Yeah, but please ask her. She spoke almost perfect Japanese.
Yes.
Yeah. Wonderful.
Okay.
Anyway, okay. Thank you very much.
Thank you very much. Bye bye.
Bye bye. Okay, bye.
Ya,
See
oke.
you.
Oke.
Oke,
Selamat,
bye.
terima kasih, kasih tepuk tangan, makasih sama Prof Nori ya. Ayo unmute semua.
Okay, bye.
Thank you so much, Prof.
Thank you so much,
Prof.
Prof.
Thank you, Professor. Thank you, Professor.
Terima kasih juga ya sudah hadir.
Thank you, Professor.
Ya. Prof Nori, I also send to you via email this
Okay.
Zoom link.
Yes, so start from the 15 minutes later, right?
Okay,
Now.
yeah.
Okay.
See you in 15 minutes.
Okay, thank you.
Bye bye.
Bye.
Arigatou gozaimasu.
Wow, nice. With Doraemon.
Doraemon. Okay.
Okay.
See you soon.
See you soon.